Hello? I'm not seeing you. I just saw you and you disappear again. Hello? Hello? Uh-huh.
Hello, sir.
Good morning.
Good morning, sir.
I'm not hearing the background, but you can hear me now, Abby?
Yes, I can hear you.
It is my pleasure to meet you guys.
Thank you.
How can I have the conversation?
I don't even know. I'm not in the venue. So I don't
All
even
right.
know.
But I was told that my own time will be 10:20, and this is 10:10.
Mine is 10:30.
Your own is what?
10:30.
Okay. So I'm just having 10 minutes.
Yes, I think 10 minutes lecture. Yeah.
So how are we? This one that you are not on the background. How is it going to be?
I don't even know. Let's see.
All right.
Yes, sir. Let's wait and see. You don't know.
Okay. So I'm just having 9 minutes left now to start.
Yes.
All right. May God Almighty make it easy for all of us.
Amen.
It is a pleasure. What is that? Is it Mufunoluwaki?
Mufunoluwatoya.
Okay. All right. It is my pleasure. All right. Let me quit till the time, Abby.
Yes, sir.
Thank you.
What was it? Yes.
It is my honor and a true privilege to welcome you to this impactful event. Radiography Symposium, the series organized by the National Nigeria Association of Radiography Students, Osun State University Chapter. As the Vice President of this prestigious faculty of Basic Medical Science, I speak to you today not just as a leader, but as someone who, like many of you, once has the audience. I remember vividly one of my first clinical postings. I stood beside a seasoned radiographer and examined a trauma case. Watching it that day changed the way I saw our profession. It was about saving lives, it was about cooking, and it was about purpose. This year team, exploring the spectrum of radiography from education to practice, would have not just come at the better time. In a world where healthcare is evolving rapidly, driven by artificial intelligence, advanced image modalities, and patient care centers, we must prepare ourselves not only to adapt, but also let it be a spark that will ignite curiosity, fuel our conversation, inspire innovation. Whether you are attending today's session or joining our virtual series later on, dive into one thing. And to our organizers, to our executives, can you please give them a round of applause? Your dedication and excellence in putting this together does not go unnoticed. Thank you for making this platform a reality. And to my fellow students, remember this: you don't need to be great to start, but you have to start to be great. Let today be the start. Radiography is more than academic pursuit. It is a commitment of life, service, and to unseen details that makes healing possible. Thank you once again and welcome.
I want us to do more than that. That was a powerful and weighty keynote address. And I want to implore every one of us to please make sure we write things down.
Be attentive in today's symposium. Like, make sure you get something down, learn something today. We are here to learn, to understand this wonderful profession better. We should make sure to write something down.
So, really quick, moving to the introduction of guests, and I want to task us all, as we are introducing the guests, you people should help us to appreciate them. So today, the number one person we'll be introducing, the guest speaker for today, is our daddy, Dr. Mus Ambili. He's the of the ARL. Then we have the honor of the Assistant Director of Radiography Services, Federal Medical Center, Ibutemeta, Lagos, Rad Sule Joshua. Also, we have Rad Osai Japhet Ike Akachuku. Also, we have radiographer and a public health researcher, and also Rad Aisha Lawan Jalo.
We have with us Brad Odedele Akintayo and an intern radiographer, Brad Adebayo Abdulatif Musa. And today we are going to be having student radiographer speakers. Oluwakemiga Moyoluwa, Ubo Mofoluwa Rex, Usman Oregi.
I also honor executives here. They are the ones that have made this wonderful program through. And this is the first of its kind, and we are hoping to have more of this. I want to appreciate the social director, Osuala Favor. Let's start for recognition. The Secretary General, Moliayo Aditola, popularly known as Baito. The Sports Director, Mr. West Doma. We have the Welfare Director, Akonobi Jessica. We have the honor of the Assistant Welfare Director, David Excel. We have the Treasurer, Adiribibe Adishola. The Academic Director, Oreofe Jesu Babalola. The Assistant Social Director, Salahu Abimbola. The PRO, Public Relations Officer, Okola Samuel. We have the Vice President, Oyiniro Obaloluwa. And we have the number one of these departments, the 001, Akeshola Ayomidot. Yeah. We have the honor of the National Assembly Parliamentary Secretary, Senator Farid Ayokole. And every other member of the Senate here, Senator Jubilee, I recommend the presence. Appreciate yourself. And also appreciate my partner and I. If you can do more than that. So without waste of time now, we will be moving straight to this symposium. So we have the honor of the student speakers now, and the first person here is the speakers are videographers in embryo. So we'll be having the honor of Olufemika Menyeluwa. She's a 400 level radiography at University, and she'll be speaking on her experience during clinical posting and research. And also, we have Oba Mufoluwa Torres, 300 level radiography student at UPS, navigating core coursework. And the last person on this list is Usman Kuretu, the other level radiography student at UNIMED, and he will be speaking on his experience adjusting to radiography studies. I want to implore every one of us
This job we are going to right now. Yeah, we need to be what we are like, I'm going to tell you what they are doing, and I would like to think them and pay attention to everything that we are going to today.
Sorry, I'm about to tell you everything about the speakers. Some will be speaking to us virtually, and some will be here. Speaker. So, thank you. Bless us all.
I want to put on the camera, but I want to like turn it to the back. It's showing like yes. I want the camera, it's showing like this.
It's not supposed to say. How did you play the audio? Can you come back?
Man, we can't talk about it. Assume it. Unmute your mic. Thank you very much. We can't hear you over here. Unmute your mic. We can't hear you over here.
Results of the rest of collection of error. The person is supposed to take part in the session as limited on loyalty. So please just bear with us for I want just a minute. Hello, can you all hear me?
Please, I'm giving him at Funto, please, can you come on?
Okay, thank you very much.
Yeah.
Good morning, everyone, honored guests, fellow students, and of course, future radiographers. It's a privilege to address you today at this symposium. I'm thrilled to share my journey through my experience navigating the core coursework of our prestigious program. I'm Obo Mufulu Atorex from University of Medical Sciences, Ondo. When I began this path, like I think 2022 or more, or less, starting core coursework in 2023, I was both eager and a bit intimidated because radiography blends cutting-edge technology, scientific precision, and outfit patient care, a combination that is inspiring as it is demanding. The coursework, however, can feel like scaling a mountain from mastering radiation physics to decoding complex anatomy, learning imaging techniques, understanding pathologies, and perfect patient positioning. The scope is immense. I can remember wrestling with concepts like inverse square law, navigating the peculiarities of imaging modalities, memorizing countless anatomical landmarks. Now let's not even go into positioning with different entry points, different exposure factors, range per body part, a whole lot of knowledge. One of my biggest hurdles was beyond just memorization. To truly understand the why behind every reason you are doing something in the department. It's not just about passing tests, too. It's about applying knowledge to create clear diagnostic images while minimizing radiation exposure to patients. That realization transformed how I approached my studies. To navigate this rigorous curriculum, I leaned on some particular things, like number one, teamwork. When you're with your colleagues, conversing, it really helps you to learn a lot. Meeting with them, this will bring his own knowledge, I will bring my own, and that person will bring different topics. The one you understand, I will learn from you. The one I understand that you will learn from me. That really helped me in navigating core coursework. Another one is clinical postings. going for clinical posting actually helped me a lot because in my school I started going for clinical posting 200 level. So that time I think it was just normal anatomy, biochemistry, physiology that we just started. Then it was not like pure radiography courses. That time I didn't know anything about radiography. I was just going to the clinic for just to look and learn anything the radiographer on duty is saying. I didn't have an idea of what was going on, but just going to the clinic alone actually made me understand what I was even doing. Another one was active engagement. Reading alone didn't cut it. I found out that creating diagrams, going to the lab, like having a skeleton in your demo room, will actually help you learn a lot. Stimulating real life scenarios, brought theory to life, that kind of thing. Another one is conversing with your seniors. It actually helped me a lot because I have that grace of like I'm a good social person, so conversing with my seniors actually helped me a lot. Recently now, I had an issue in school. Like I was given an assignment, I didn't have an idea. I just sent it to my departmental president. That, please, oh, can you help me with this assignment? Stuff like that. Immediately she answered me, okay, this is how you go about it, this is how you go about it. That thing will actually help you as a radiography student to go coming up. It will help you to actually know a lot and actually have your hands on things like that. And my advice to those that are actually like upcoming radiographers like us, like is, I just tell you to do is just stay curious, ask questions in class. Don't feel your question might be stupid or ashamed. Ask those things the way you feel like you can stay. Don't feel ashamed. Don't feel anything. Another thing I know that you should practice, keep practicing, positioning, just keep practicing because repetition builds mastery. Just keep practicing. Another one is embrace feedback. Lean on your instructors and clinical mentors. They actually help, especially those ones that just graduated from university. They actually help a lot. You can actually need them for advice and you actually. Another one is prioritize self-care. This program is actually a lot. Does balance studies and have enough rest. I have a particular senior. He reads a lot. Sometimes the time he checked his BP was very high, very high. I told him that Alpha, relax. So if you die today, photography will continue. You just have to relax. You can't just kill yourself because I want to pass, I want to pass, I want to pass. We know we all want to pass, but that step first is very important. You guys, you just have to rest. And one is just believe yourself inside. This course it will bring you fortune. You might not actually feel it now, but I know that later in life you actually because I know people that this radiography is giving them good money. It didn't just happen once like that, but they kept believing and they still at least did not back out on the course, that kind of thing. Another thing I would is that just I would just say that self care again. Just try and rest as a radiography student. Don't stay hydrated, take breaks while reading. That's another thing that actually helped me when I was as at last semester during my in class, I always should do tell us something. An hour of lecture, stand up and walk around. Be hydrated. Let's say you're reading for 6 hours, every hour, take breaks, relax, that kind of thing. That's actually everything. I think that's all for now. Thank you.
Good morning, everyone. My name is Olugben Omoyoloa, a founder level student of this city university, and I'll be talking on my experience in clinical posting and research. So, as we all know, clinical posting is a very, very essential part for our course because learning the theory within 4 walls of the classroom is not enough. We are knowing the theory, so when we start practicing, we
Morning,
know
sir.
how to refer to our
This
practice.
is kind of already
Clinical posting is where we get the practical, where we are
I
able to
one more
perform
minute.
what we know in just practical and make it tangible what we know. So, my experience in clinical posting,
It is my
first off, you're not having to carry on. You're not having to do it. Everything is in place. You have to like start trying to remember. Oh,
Can I
okay, like when it comes to training patients, you are told go and position the patient, and it's not like you have to quickly start referring to your like your AC class and say, oh, okay, I have to position the patient. You've already been taught this, and then you just have to apply it. And it is okay to make mistakes as a student when you are doing your clinical posting. It is through years of experience that is how we are able to live and we're able to stand firm. If you make a mistake the first time or you are being scared that, oh, I don't want to do this because I'll make a mistake, then you are not ready to learn. So it's okay to make mistakes. That is why you're still a student radiographer. During your clinical posting, if you probably maybe the orientation of your case sets is not in the right position or you are not getting the centering point, you can easily refer to your supervisor and say, oh, I'm not very confident in this. I don't think I'm getting it right. And they will put you through. You don't have to be scared about, I don't know how to do this, I don't know how to do that. Also, I remember during my clinical posting, so I was able to interact with patients and then I was able to see some procedures. Patient interaction, we are always taught how to interact with patients in class, but when you go for clinical posting, it is a different thing because you see it in real life, and then sometimes you begin to wonder what I was taught in class is way different from what I'm experiencing now. There are some patients that are very calm. There are patients that they are very, very aggressive, and then you look at it and be like, I'm just trying to perform my work here, I'm just trying to do my work. So we should also learn that when in the course of this profession, we are also human beings, and then we have to care for these people. There's some people that they tell you they've heard stories about radiation, they know how radiation can kill and all of that, so they're always scared to come in for examinations and tell you, oh, if you expose me to radiation now, I'll have cancer and all of that. You're the one that have to take your time and explain to them that it's not like it doesn't have side effects. In as much as it has side effects, we're also using it to try to know what is going on or try to find out a particular disease in the body. So patient interaction is one thing. Then also the procedures that we do, seeing it in reality. Like I was privileged to see a lot of procedures on barium studies, which fluoroscopy is used, and real-time imaging is used. So it's in as much as radiography is like we say the eyes of medicine, it's actually also a wonder because you are able to see what is going on in the body in real time, and you know you are seeing everything as is happening. So, and also for research, let me say research is one course that we actually do here in my school right from 400 level. We have been exposed to research methodology, and they give you topics to go and make research on, and then you have to look for materials, journals from past people. You have to ask questions. It's actually not an easy thing because as you are asking from people, you're also making researches even on your phone. It's not the copy and paste a research that you want to, oh, let me just copy and paste and just submit. You are going like in depth. For example, I did a research on the long-term and short-term effects of radiotherapy, of radiation in under radiotherapy, because when we talk about radiotherapy, we use a lot of radiation, and in as much as we're using radiation to cure cancer cells and all of that, it still leaves the patients with some side effects. I did a research on the long term and short term effects. I had to, look for cases, look for journals, textbooks, and all of that, just to help boost myself and also to help my learning process. So, clinical posting and research is a very, very essential part of our learning process. It helps us to, have more insights apart from all the theory that we are learning, the 4 walls of the class. It gives us practical experience. It helps us have the hands-on experience that we need. Because when you are done with school and you go out there to practice, nobody is really ready to start coming down and say, oh, let me teach you. No, they expect that in your 5 years in school, you already know all of this, and then you are just coming to come and build on what you already know. You're trying to get an experience, a practical experience. So clinical posting, even during your holidays, there are some people that can just decide, oh, during holidays you're not doing anything, let me just sit down at home. No, you still have to also even go for voluntary posting, like, oh, I want to get more knowledge, I want to know more. And it will definitely help, because nowadays it is not what is in your head in this profession. It's not actually what is in your head, it is your skill, what you can do. If you can be a first class graduate and still not be able to perform a simple x-ray such as chest x-ray, it is very, very possible. And someone that graduated, let's just say third class, can perform, even special procedures. So clinical posting is a very, very good opportunity for us to learn more, to know more, and to see practical experiences and even things that are not being said in the classroom. In clinical posting, you will see them, because you will definitely see, they only tell you, oh, this is how to handle patients. But when you go for clinical posting, you get the experience, you see, okay, this is exactly what they were telling me about, and then you learn more. You'll be able to interact with senior colleagues in the profession. You'll be able to, ask questions and just add more to your well of knowledge. So thank you very much.
Good afternoon, man. We would like to have Miss Jalo right now. Can you hear me, ma?
Hello, good afternoon. Can you hear me?
Yes, we can hear you, ma.
Okay, how are you doing?
Very fine, ma. Your session starts now. You can actually join in, and they can hear you over here from the audience.
Okay.
Okay, thank you very much, ma.
So I can comment, right?
Yes, ma, you can, and we would like if you can turn on your video if that's possible, or if it works for you.
Okay. I think it's on now. Okay. So good afternoon, everybody. You can hear me, right? Can you hear me?
Yes.
Can you hear me?
Yes.
Oh, okay, okay, thank you. My name is Aisha Jalo. I'm honored to be part of this webinar today. I thank the organizers for inviting me to speak on this platform today. And my journey has been, one of unexpected turns, growth, and mentorship. And I hope that by sharing my journey today, I can offer practical guidance and inspiration to students and young professionals, navigating their own path. So I didn't exactly choose to study abroad. I accidentally found myself there because it was chosen for me by my mom. It was chosen for me by her. So she chose Egypt for me because of the long-standing, medical education there. So I really did not have a specific place where I wanted to study after secondary school. So, and then they really have, good medical educational system there. So that's how I found myself in Egypt. And, it was one of the best things that actually happened to me because the educational system, the medical educational system at a very young age. Even right from first year in uni, I came across nuclear medicine, all bone densitometers, ultrasound, all the likes of that. And even right from second year of uni, you get to have like workshops, you do hands-on and stuff like that. The workshop can last for as long as you want on like any modality that, you have interest on. So you do things like that. So it was really an amazing opportunity, to be honest. And another thing that actually made my journey easier for me in university was we had academic supervisors, so they actually made the journey easier for us. Because finding yourself in a place where you really don't know anyone. You're finding yourself like for the first time there. There's always confusion and all of that. So you get assigned academic supervisors, so they make your journey easier. So if there's anything, any confusion, if there's any help you need, be it academically or anything, they're always there to actually help you out. So it was really an amazing experience, I must say. And the curriculum was actually very good. We're taught in English. Egypt it says that, predominantly you speak Arabic, but we're taught in English. So, and then the curriculum was actually very comprehensive. So, and it was globally relevant, to be honest. So, it was actually good. And we rotated around all the high volume hospitals where you have a lot of cases and patients. So, it gives the exposure to like a lot of, clinical experiences, and it actually shapes you and like in a very different light. So, which is good. And during my university days, I actually had challenges because finding yourself in a place like Egypt, you're bound to have cultural and language barriers, so which was really difficult, especially the language barrier, because if you're outside your university, you're bound to have to find people that don't know how to speak English, like a taxi driver. So, of course, there'll be people that would definitely want to cheat you. If something goes for like £20, it says like £80, and you wouldn't even know. So you'll be cheated. So, but along the way, one will have to overcome all of that and become very resilient and stuff like that. So it wasn't so bad. Once you're able to overcome, everything becomes easier, like, as time passes on. So I spent 4 years in school. So when I finished my university, I came back to Nigeria. So before you sit for the license exam, the board, introduced something called the training program. It was a joint venture between Kano Teaching Hospital and Bayero University Kano. So you have to go there before you do license exams, and you train for like a period of a minimum of 6 months. It depends on, where you did your undergrad. So they will look at the curriculum. And if you feel like, oh, you'll do 6 months, and they'll tell you to do 6 months. So mine was actually for 6 months. Even though at first I was like, why? Because it actually makes sense to me because, we weren't doing it before, but actually when I went there, it was a very transformative phase in my journey because I actually met people whose perspective on radiography challenged and expanded mine. And it was there that I began to see radiography not just as a career but as a calling. And I learned that the path to professional growth is not only through knowledge but through community and shared passion. And it was there that I actually learned, I understood radiation physics better because when I was in school, I was actually not so good at it. I struggled so much with it and research. But through that 6 month program that I did in Kano, it actually helped me in terms of radiation physics and research. So it was actually something that I'm actually thankful about. So I cannot really complain about it. So after the 6 months of my program, I applied for an internship, which I did at NISA Premier Hospital. Even though at first I was not really, you know, into the internship because I had something else going on for me. I was doing a business that I found more exciting than the internship. But I met a chief radiographer of mine. He changed the trajectory of my career because sometimes I tell myself like I don't think I'll be who I am today without him. His name is Mr. Obaka. So he actually changed the trajectory of my career. And for him, radiography is not just it's not just how people, make it seem like it's like they like how would I put it? It's like you're trying to make ends meet with as a career. For him it wasn't just that. It was like his life's work. He was dedicated he is dedicated to radiography. So he made it a point, he made it a duty of his to instill this, that passion in him to do the same to me. And I believe that really changed my life. And through his mentorship, I feel like it really changed my life and it really made me the geographer that I am today. It gave me the first kind of mentorship and really shaped my identity as a radiographer. And he just made me see radiography beyond machines and images. I mean, just have to be innovative and, have to, just innovative. Something as basic as, like, for example, I had a time a patient came for MI, it was a baby wasn't cooperative, and I was like, okay, there's no point doing it, let's sedate and stuff like that. He told me that, oh, we don't have to do that. Let the parent of the child, go into the machine. Let's see how that is going to be. And the patient cooperated. So that was the kind of person that Mr. Waka is like, the time that he was with us. But I mean, he has moved on, like, he's no longer with us, like, he's elsewhere now. So he gave me the best kind of mentorship that one could have ever asked for. And now I make it a duty of mine that if I have any mentee that's been attached to me, I try as much as I can to pass the same knowledge that my best ability that I can to them and always advise for professional development because continuous professional development because that's the best way that one can always learn and it's always very important. I keep emphasizing on it because learning doesn't just stop after you do your degree. Like for example for me now, after I finished my degree I made it a duty to do like a lot of courses after graduation because I've done my PGDs with IBN and even that after that I've pursued other ones which I'm still currently pursuing. So I feel like the only way like one can evolve is if we continuously keep learning. That is just the best way that one can keep, you know, moving forward and excelling. Yeah, so that's it. Can you hear me?
Yes. Yes.
Yeah. So yeah, that's what I always advise for continuous development. there anything anybody wants to ask in particular? Any questions?
No question.
Can you hear me, sir? Hello, good morning, sir. Hello, can you hear me, sir?
Good morning.
Hello, can you hear me, sir? Hello, sir. Can you hear me, sir?
Yes, sir, we can hear you. We can hear you, sir.
Hello?
We can hear you, sir.
Okay. I am a student in mechanical 100 level student of University of Madrid, Department of Radiography. I'm to say little or few based on my experience in the university as 100 level student with regard to the adjustment of curriculum during the training. Honestly, it is an amazing one to find myself in this forum. I appreciate the organizer and may God continue to bless you all. Those that make it come to reality. It's not an easy task. Hello, can you hear me? Hello?
Yeah.
All right. So as a new student that is hoping to become a radiographer and teacher, you know, in this kind of forum, I only have to say. Nevertheless, based on my experience, I'm able to say something that will make a meaningful contribution to the forum. Regarding to the topic of the area that I've said, once they say adjusting curriculum, that is to tell you that something is in existence. Either you add or you reduce, you bring or you move. So that is what I want to say. Definitely, it is a privilege for me to find myself in University of Medical and to be precise in the radiography department. The department is doing wonderful in line with MBT standard to ensure that the quack students of radiography are not being produced. Rather, the productive radiographers are the ones that are being produced at the end of the training. Having said that, there are some courses or there is a course that if you are a student of radiographer in that university, I'm saying in that university because that's where I went. I don't know others, but I'm saying based on my own experience, based on what our lecturers told us, that they don't teach them until when you reach sometimes 200 levels, sometimes 300 levels. Most especially intro to radiography. That is your core course of studies. But year one, year two, most at times you end up doing more course and other courses that will make your life. In fact, you feel as if, why am I here? But to the glory of God, based on the effort of the capable, able team of the lecturers of the department, with the effort of the VC, current VC, added with standard of technical education, they were able to brought back those courses, not to be teaching new students at maybe 200 or 300 level. No, rather they should start learning them at 100 level first semester, so that those books will not be stressed by. So no matter how you get used to the courses, and before you know, what are you expecting? A better and standard radiographer at the end of the program, which we are privileged to be the first set to be introduced to those courses. I have to tell you the truth that there are some things that even our seniors are jealous. That if I should tell you, you'll be surprised. Having known that radiography is a course that deals with what? Science and art of using radiation and no radiation, ionized and non-ionized radiation to diagnose and treat patients. That told you that it's not only you sitting in the class to just receive the theory lecture, rather, after receiving the theory lecture, you need to go to field and see those things that you are being taught in reality, so that anywhere you find yourself, you see that you should be able to know that yes, this is radiography, this is interventional radiography, this is radiotherapy unit, this is ultrasound scan, this is fluoroscopy, this is computer tomography, this is instrumental. All those things, I'm telling you the truth, we are being taught all those things. And with the effort of our president, that is Omara's president of the department, he organized for orientation to the teaching hospital, which he conveyed all of us, took us to various units, specialty radiography. In fact, we are able to discuss one-on-one with radiologists, that is heavy interventional radiology. He showed us fluoroscopy, purpose of fluoroscopy, procedure that mostly be used, carried out with use of fluoroscopy. It was so amazing. He even told us that unlike other disciplines, like nursing, lab, pharmacy, physiotherapy, that steering power to between doctors and all the allied medical science. In intervention radiography, not like that. In radiotherapy, not like that. Radiologists and the radiographers, they are like 5 and 6. Oncologists and radiographers, they are like 5 and 6. What does that mean? It's a concept that once you are able to graduate, you are above somebody to look down and telling you that because you are not a this or you are not a that. No, our work is more than that. It's like you are using the right hand, scrubbing one side, then you are using the left hand, scrubbing one side. You and whoever is in the team. It was so amazing. Honestly, going that show, I developed interest 100% to focus and ensure that I have become a perfect and very knowledge that community will be part of me tomorrow in my area, especially that is my program. So wonderful. So I will advise not only those that are foreign, those that are willing to come, if they have the privilege, they should come to you. It will surprise you if you go to radiotherapy. All this linear, all these cobalt system machines used for treating cancers, they are there alive. If not this flood that has happened last year, I guess all of you have known that Meduguri have suffered flood when that leg break almost covered the whole town, which affected those sophisticated and very expensive machines. As of the time that we went for that show, all the machines, costs, we are being fought by the water, they are no longer, but they have brought new ones. As of that time, the head of each unit told us that the machines are illegal. They are just waiting for whatever to bring into object. They are any machine you know, as far as radiography is concerned, or radiologists, Unimed have before. If you go there, it's just that unfortunately people don't have them happen to them for a longer portion of their own way, which I believe by now those machines are hopefully maybe they don't have installed it. So it's a place that I'm not regretting on myself because I see what I taught in class theoretically, in reality, that is practically, that is all about radiography. You know it theoretically, then you should be able to execute it practically. So, my respected senior colleagues, I'm humble and privileged to be on this symposium, and I'm equally happy to be in it. I cannot end up my discussion alone without appreciating the department leadership from the head to the least senior person. I must appreciate them for the effort that they made to ensure that our teaching and our stay here for this solid 5 months that I have spent there, I have gotten what I get academically. I'm not regretting. And I wish them well. I wish the management of the department, management of the faculty, and the VC of the university a very wonderful, successful career in all their activities. I think, based on my experience in Unimed, I have said a lot. Unless there is anything that somebody may like to ask me, if it's within my capacity, I can be able to share more light, because it's not that easy for a fresh or beginner to say AOB in the presence of his senior mentors like you guys, but nevertheless, based on experience and edge, to be able to say something. So thank you very much, and may God bless all of you. That is what I have to say regards to my topic. Thank you, and thank you, ma'am. I remain Usman Muhammad Uregi, 100 student of the Department of Agriculture. Thank you, sir. Hello, sir. Hi, people hearing me? Hello, sir. Hello, sir. Are you with me? Hello, sir.
A statement which I'm going to reiterate. He said, Radiography is more than machine and images. It is more than machine and images. You have to make research. You have to, put in your own innovations. And try to learn what you have
Any other person? Guys wants to add to is there anyone from 100 level that wants to talk? Right. So the level. What? No. Good and religion. So even when you add teachers or yes, good morning, everybody. Good morning, everybody. Good morning, everybody. How are we enjoying the section too? How are you enjoying the session? We apologize. We know that it's going to be uncomfortable. It's going to be unusual. We are going to be having our physical speakers soon. We'll be having our physical speakers soon. So all we just ask is here with us. Damola, are you on your body? So we just ask here with us. We'll take about 2 more online sessions. And in the meantime, the physical speakers will be around. Then we proceed to the physical section. Is there anything that you want, anything that we can do to make the session better? Anybody? Are we even listening? How is the audio? Has it been good? Very bad. So the issue is the audio, right? Very apologize. So make it better. What about the video, the projector? We'll make the audio better, we'll make the video better. And we'll have our physical speakers in about 30 minutes. 30 minutes max, we'll have our physical speakers. So please let's try our best, pay attention. We are meant to learn a lot. We are meant to learn a lot. So thank you. Thank you. We'll be having another virtual session. And let's talk taking us is Dr. Shule Joshua. With over a decade of experience in Lagos and concurrently leading Synergy Depot and Services Limited, Dr. Shule Joshua expertise diagnostic medical imaging and radiation protection and the paramount to advancing patient care, the public and staff members at the Institution of Radiography. He has served as the National PRO and Media Specialist in 2020 to 2021, anywhere he leveraged his analytical skills to manage the institution's reputation while ensuring the highest standards in radio access. Radiation protection to medical ultrasound. His mission is to merge technical proficiency with compassionate communication, embodying the values of precision and fidelity that resonate with the AI culture. the radiography profession. He is the lecturer in the Department of Radiography at the University of Lagos, where he is committed to the quality education and training of the future radiographers and will shape the 21st century practice of radiography and medical imaging healthcare transformation. And I will be speaking on his experience during practice in the public sector in Nigeria. Ladies and gentlemen, with happy innovation, let Dr.
Thank you very much, my wonderful future leaders and amazing students. It's a privilege to be on this podium tonight, addressing you guys who are really doing everything very excellently to bring hope and radiance to this profession that we all are proud of. Sorry, I was to settle down where I was noisy, and then to come to a center place where you can all see me clearly. Am I being heard by you all, please? Can you hear me?
Yes, sir.
Yes, sir, we
Yes,
can
we
hear
can
you.
hear you.
Okay. All
We
right.
can hear you.
I want to appreciate the leadership of the Nigerian Institute of Radiography students, Osun State University chapter, the president, Comrade Akinshola Ayomi Dotun Olawale. I want to thank the secretary, Comrade Adetola Imolayo, and I want to thank the secretary for the Nars Uniosun Symposium Committee, Victor Oyewole, and your amazing colleague who also reached out to me, the person of FA God's Power. I am very impressed to see youngsters like you coming out radiantly to get yourself enlightened in the aspects of your professional choice, radiography today. We were not privileged to have this opportunity when we're in school like we are having right now. And I must tell you that you are doing it rightly. For that, I would like you to clap for yourselves, please. That's amazing. All right. I am asked to speak on the topic experience of the practice, the public sector. I wanted to make this very interactive. I don't know if it's possible with your media connections, so we can listen and talk and share ideas. And you get to learn better and hear better and be more enlightened about the good profession, and you'll be well equipped, with the needed knowledge as you strive to become better both within your classroom and outside your classroom. Now, what brought you to radiography? Why not studying any other course? What's the purpose that fueled your desire, the motivation that made you choose this course when you're filling your jam form, or when you decided from your secondary school to become a radiographer, a medical radiographer, a radiation therapist, a cross-sectional imaging radiographer who does the computer tomography scan, the magnetic resonance imaging scan, also known as the neuro radiographers, for those that does imaging to the brain. Why do you want to become an intraoperative medical imaging specialist? For those of us who will be found in the theaters, taking part and being part of the team that does orthopedic surgeries, neurosurgeries, and cardiothoracic surgeries, and so many others. Why do you choose to use radiation to attend to patients, to ameliorate their suffering, to cure them of their illnesses while managing symptoms and the prognosis of every pathology they may have in the accident and emergency where they are also suffering or suffer from any trauma. Why do you want to be seen in the wards? Utilizing radiation to attend to patients who are found on the ward that need radio diagnostic services to enable the clinicians, manage them properly and their health outcome well achieved. Why don't we find the intensive care units in hospitals where people are almost dying? They are not sure of even surviving the next 24 hours, but you want to be seen as a soldier, you want to be seen as a professional radiographer or a colleague or one in the health sector coming to attend to them when they are even on life support machines. Radiography is very important in healthcare, and I'm very happy to be called a radiographer. Very proud one as well. And I have a lot of colleagues who are very proud to be called radiographers. So I gave you this little preamble asking you questions so that you can recover yourself if you have not found yourself worthy, you have not found yourself so happy to be in the best professional in the world. I'm trying to let you know now that you have not made a mistake in coming to study medical radiography in your school. And for that, I want to clap for yourselves again, please. All right. That's it. Talking about my quick experience of public sector. So I'm not able to share my slide. Your planners got back to me yesterday. I had planned to do my PowerPoint over the weekend, and if you have a robust slide. But however, let me share what I know with you from here. Now, I hope you can all define radiography. Can somebody amongst you define radiography for me? Because we don't even know what we are talking about. I don't know how I should continue. Can you define radiography? Who is a radiographer as well? If I can get 2 persons from the audience that can, define it for me quickly, I will move on. Define radiography and define who a radiographer is, please. Hello.
Good afternoon, sir.
Yes, good afternoon.
Obviously, or producing
Well, I can't really hear you. I didn't quite get what you're saying, but the first thing you must know first is to know what radiography is. As students who are studying a course and then becoming a radiographer after you have finished a 5 years study, 1 year of internship, and 1 year of NYS, making it 7 years to be called a radiographer with a license. It's a long journey, and I bet you, if you don't know the meaning of these 2 words I just mentioned, radiography and radiographer, then you may be in the wrong place. Along the line, maybe I'll define it for you, but for now, I want you to still think about it. How are you defining radiography? And you define it better when you know the concepts, when you know the content, and then you know what you can become if you are through the processes of being produced to become a product called radiographer after 5, 7 years of your life in school. Then you know that coming out with the experience that you need to be found either in the public sector or private sector is very, very cogent, and it's very important for you to know that. Now, the public sector in Nigeria, for example, where we are found in civil service, is headed by the head of the civil service of the federation. All right, under the guidance also of the presidency. Now we come to the Ministry of Health, now named Ministry of Health and Social Welfare, headed by the minister. And then we have the PAMSEC of the permanent secretary of the Ministry of Health. We have the director of health hospital services, and all these persons are involved in the employment of one who is called a radiographer, qualified from school after meeting all papers and training, have the license, and then can be employed by the ministry to work in the public sector for the government. All right. So the first thing is the correct education of the 5-7 years. Then be licensed by the professional association, the RRBN, which is the regulatory body for radiographers in Nigeria, radiographers in Nigeria, headed by a registrar who must qualify you worthy to practice radiography in Nigeria with the license. And then you're becoming a member of the Association of Radiography Nigeria, the ARN. Ensure that from your training level, you'll be indexed both by the RRBN and the ARN, and you become student members. And then as you graduate after induction, you become a full-fledged member of these two bodies I've mentioned. And with that, you are qualified to work in the government sector. That is the first thing you must do. Now, the government hospitals are in Nigeria working very well. And I can say the working very well is in parentheses in quote, because I know currently that most of the private centers are doing and are doing a government hospital. Just about a few places we have standard practice. And I'm hopeful that before you come out of school, this hospital must have been upgraded and they'll be doing well. Are you saying amen to that?
Amen.
I can't hear you.
Yes, sir.
All right. So working in government hospital provide you with opportunities to serve diverse population of patients. And again, this is not without challenges. Government hospital, like I said, give you environment to utilize your training in school. All right. And there are challenges that come with working in government hospitals. Now, you have limited resources. There are high patient volumes, and maintaining equipment is also a problem when it is compared to a private owner who is paying back loans to banks and trying to keep up with the competitive market. Whereas in government, up to recently, when they began doing private-public partnership, where a private owner of resources or equipment can come discuss with the hospital, approved by the ministry, and private people cannot be found in government setting. But if you talk about government work properly, most of us don't want to be in government. But I'm telling you that things have changed and you can become better. Now, the first thing you must decide as a radiography student is to know where do you want to be found in the next 5 years, the next 10 years. What do you want to be called? What do you want to contribute to the profession? Do you want to go into the public service or you want to be in the private sector? When you know this on time, it gives you a focus, a locus where you are going to work towards to become a professional that will be known in that industry on this aspect of radiography practice. So please, you must decide. It is not too early to know or to try to know what you want to become and work in that line. While you learn everything that you need to learn right now in school to conquer the whole quality training of radiography, you must also decide to where you want to be found in the profession at large when the time is right. Now, we have a lot of rewards. Making a difference in patient lives, collaborating with multidisciplinary teams. You work with a lot of persons. Almost every department that you need in the health sector is found in government hospitals. In private, it may not be this rosy because they have to invite this consultant from government hospitals to come attend to them. So you are availed the opportunity of interfacing with various aspects of medicine in government setting. All right. You need some key skills as radiographers to be found in government setting, which are what? Your medical training, your technical skills. You must be in touch and in very, very consonant touch with technology that's always advancing. All right, AI is coming, robotics coming into medicine and health practice, and radiography will not be left behind. So machine learning is also coming. You have to keep up studying updating yourselves in what is new, what is trending, what is the new thing coming into radiography practice and healthcare practice, so you will not be found lagging behind. Currently, most hospitals have gone into electronic media and medical record, and you cannot say at this age that you are, you're not a computer IT savvy. At least you know basic operation about the computer system, your laptops, your desktops, your software, basic things about how to go about acquiring images. You must learn them. You must have them in touch and in tech, in touch with technology right now. So this makes you become a better practitioner in the public sector, and you'll be found very important when you know what you are doing as a radiographer. Even the CMDs and the MDs of hospitals and these consultants whom you work with will see you as a very useful, professional that they always come to call on when they have one or two things that are very clear to them. You must not be a radiologist to report films. Most do radiography, film reporting, anatomical structure, your physiology must be tight, your pathology must be good. All right. So you have a opportunity right now to learn in school. Don't come out of school and be struggling to know some things you need to know right now in school. So beyond positioning, beyond technique, beyond just photography and equipment, get yourself involved in clinical things. And it's best now you study them. Make friends with those in medicine and surgery. Make friends with those in nursing practice, so that you can nursing sciences, so you can learn one or two things from them about hospital care. The Europe is a very big high tree that one climbs and tries to bring down every firewood and fruit you can bring up, because the amount of soldier ants and insects that will sting you or bite you when you're up there are many. So as you are climbing this ladder to become a radiographer, you need to start reading beyond radiography, so you can have a robust training. And when you come out, you will not be found wanting in some basic things when your colleagues or your sister professionals who are in other fields will not see you as an entity or somebody that don't know what you're doing. So technical skill, like I said, communication skill, you must have them. Communication skill. All right. Sorry. Your communication skill has good things and senses. Pick your time. Pick the local terms and get used to them. You must not communicate both to yourselves as videographers among yourselves, then your colleagues, your fellow colleagues, members of staff in the hospital setting, and then the patient. You must have empathy. You must also understand pathologies at how they affect every patient that you're going to see on every request form. They are not going to be the same. I can have 5 different pathologies requested for SSA in a day, and they may not all be the same. And the pattern to which I attend to them. Respect for your patient is very important. You must also always learn to communicate properly by doing yourself and then explaining to the patient what you want to do for and with them. You don't just call them any other titles. Some persons who like to be called by their title. Then you must also be respectful in attending to your patient. So, problem solving skills. You must have very good problem solving skills, and you must adapt to good use of your equipment and patient needs and protocols. All right. And you will not see this next point as a non-necessary aspect of your being a developer sector. Continuous learning. We have the continuous professional development courses run by the RRBN and other courses you can do in bodies that relate to radiography, ISRRT, certain project developers in the UK, and plenty others you can get online. You must keep yourself, like I said, updated. How do you become a best option in the health sector? You must have patient-centered care skills. You must prioritize patient safety when it comes to identity protection. Talking about the care of patients that they're studying in school right now, and then identity protection. We have the deterministic and non-deterministic in effect radiation. So you don't just expose or irradiate anybody anyhow. The name of that be a geographer. So collaboration, you must work with other health sector professionals to achieve more. It's a teamwork in the hospital. Like I said, if you're a better prepared radiographer, you'll be found wanting everything and you have your respect in the hospital setting. Quality control, you must ensure high quality images are done. All right, good images. Know the technique very well. Know how to collimate properly. Know what is needed for every request that you are attending to and every pathology of the patient that is sent to you. By so doing, the images and the radiographs you'll be producing will be of high quality and they'll be of high demand. So what are the career opportunities in the public sector? All right, we can become directors of the government services. When you come in first, you start off as an intern. All right, from an intern you go for your NYSC as a corporate radiographer, a core member radiographer. You will also be found same within the hospital setting, and then you come back as a radiographer. From there, you can follow the normal progression from an intern to a core member, then become a radiographer proper, to a senior radiographer, become a senior radiographer. From a senior radiographer, you spend 3 years on this one I mentioned. When you become a chief, you spend another 3 years again, chief radiographer. Then as a director, you spend about 4 years before you become a deputy director, and that 4 years before you become finally the peak of it, a director of the services on level 4, on grade level 17, which is called 16. So you must have to go through the process. There are basic experience for every level of being a radiographer in the public sector, and that will make you, progress very well in your professional practice. In all this, please remember to belong to the association of Radiographer of Nigeria, because they come fight for you, your welfare, your well-being. When government has to shift you, they come in. And the radiographers in Nigeria are under a union, the Nigerian Union of Allied Health Professionals, NWAP. If you've not heard it before, I'm telling you now, union are the one that negotiate with government, all right, when it comes to issues of labor and your salary and all that. The NWAP will do that for you. And then the brother joint union or a body that can fight for all professionals is a joint health sector union, JOHESU. You must also know about all this and how they operate. My time is not too plenty. I would have given you, benefits and all that. But I'm trying to make you understand that you must belong to an association, belong to a union as you practice in that sector, so that you will not be marginalized and kept, one-sided. You must also learn to, specialize in an aspect. Radiography is very broad. I tell you for free that we have not even scratched the periphery, all right, of radiography practice in Africa. We are still very at the peripheral in the stage, and we are not yet done. So learn now, what aspect of radiography do you want to be specialized, become a specialist in? After your BSc or Bachelor of Radiography, depending on what school you are and what degree you are being given, you must advance to do your master's. Go ahead, go to school until we begin to do residential radiography. Do all you can to get all the diplomas, PGCT, and all courses done by the board, and the ones that are done by the university, get up to PhD level. You can become it. You can become a professor, even as you're working for government, so long as you have time to go to school and your management allows you and you're among yourselves and arrange yourself to go to school. Do not be limited and stay with only first degree. So when the time is called, you'll be found there. Pharmacists are now called consultant pharmacists because they are allowed to go to school. We are not able right now to have the West African College of Radiographers, we should be trying to achieve over the years to start residence for radiographers. But please, don't sit down and wait. As you come out of school, as you get job, as you start any salary, please still contribute to getting yourself more educated mentally and cerebrally, so you will not be found wanting when the time is right. As radiography students, you're embarking on a rewarding journey. Remember to stay focused. All right, develop your skills and prioritize patient care. I'm confident you will excel in the profession as you do all you can now to become the best in your class, in this field, and in the next 3, 4, 5 years, as many of you are in school right now. I know you can as well. Follow industry development and trends. Attend workshops. Go for conferences. It may be tough, even as student right now. The next conference is in Lagos here, November from the 16th to 18th. We'll be here during the annual scientific workshop and conference in Lagos. Next year to be in Abuja. In the next few years, these two places should be the place we plan to attend. Talk to your lecturers. Apply to your school. get sponsorship, get your bosses and attend as students. It will ginger you. It will make you get to know mentors, senior colleagues, and you also listen to scholarly people. And you can motivation from most of these things we before the conference. Leadership is very important. Get and try to have people who you are looking at role models. Look for Nigerian developers who are excelling and try to be close to one or two of them. Also want to become a mentor to some other person now. So you can all right. I want to appreciate you for letting me to give you this short talk. I wish time to do again, but we are but we'll stay in touch. And I pray when I see you, you all very excellent and radiant videographers. Thank you all, and tell yourself congratulations for being the best you do right now. All right. I'm open to any questions and any points you want me to talk on. Thank you.
Absolutely, sir.
Good afternoon, please.
Yes, sir. You spoke about the fact that as radiographers in Nigeria, we are still like very, very limited in how much we are able to explore. We talked about still being at the very, very late. So I wanted to ask what else is there about radiography and what other aspects have we not fully entered into in Nigeria? And also, what is the future that you see for radiography in Nigeria? Thank you, sir.
Okay. Thank you for that question. What I'm saying is radiography is big and there's no limit. You cannot say because Mr. A or Dr. A, Miss A is doing this, I cannot, do better. They have not touched really. They are still evolving. And what I mean is you find out the time that you can, be known and recognized as a professional specialist in the field. Radiography is still very, very untouched. We are still, scratching the peripheries of radiography, and we can become better still. What I mean by that? In Nigeria, we have a lot of limitations. The equipment we use in Nigeria are not as modern as the ones being used in places like the UK, Canada, US. We buy used machines. In modern places now, some Western states now, they use, remotes. They use just a touch of buttons. But in Nigeria, we still push machines. We still struggle with our vertical beams, tube heads, with all energies. But in other places, just a touch or a voice command, and they are already working. So it's part of what I was saying about our limitations and being a peripheral practice of radiography. I hope I've not confused the Rhoda and all. Hello.
Thank you very much, sir. There are no questions anymore. We really appreciate your
All right.
presence. Thank you, sir.
Thank you very much, and see you at the top.
Good afternoon, Mr. Adibayo Musa. Can you hear me?
People anyhow because we
Sorry, can you hear me?
people so they have knowledge to be able to put in practice
I can't hear you. Can you hear me?
and not be with other.
Okay. Can you tell the speaker?
Can you guys down?
Sir? I don't think.
Good afternoon. Can you
Okay.
hear?
Yes, it's better now. We can hear you. I think it's quite better now.
Okay. Good afternoon, all radiant colleagues. Thank you for having me. I'm Rad Adebayo Abdulatif Musa, an intern radiographer from UIETH. I will be speaking on the reality expectations of internship now. So, what's internship? Internship is actually a 12-month training under supervision by a senior radiographer to prepare radiography graduates for full professional practice. The internship is similar to our clinical posting, but it's just that in this particular internship now, you are more independent. Doing your clinical posting, you are allowed to attend to real-time patients, but under very close supervision. But as an intern, you have that degree of freedom. At least you can actually attend to patients independently, though under supervision, because you are still allowed to make mistakes. After the radiography program, you'll be given a temporary license, like a provisional license, not a full license. So it is after your internship that you get your permanent license. So the internship is a requirement for you to get your permanent license. So before starting internship, the board usually release a list on their portal, the list of accredited centers where you can actually do your internship. So once you go to the board website, there's always a list where you can download to see list of accredited centers, the slot that is available. So, but there's one thing. The thing is, sometimes you might see a particular number of slots on the portal, but in reality, that's not the actual number the hospital is taking. For example, in UITH, where I'm currently interning, in the board website, we have the slot given to UITH is 22, but we are currently they only accepted 10. You get so the number is just there to tell you the capacity to which a particular accredited center can take, but it does not necessarily mean that they must take that particular number. But most times, they cannot exit that particular slot given to them by the board. So now, what are the requirements for you to have before you qualify for internship? I think the first thing is your bachelor's degree in radiography. You have to go to an accredited school. We have accredited radiography schools. Now, if you are going to a school that is not accredited, you will not be allowed to do internship. That's because you will not even be inducted. It is only after you are inducted that's when the board can give you provisional license. But if you check, I think most of the schools that's offering radiography today at university level, they are accredited. So by the board. So once you complete your program and it's in a school that is accredited, and sometimes accreditation also expires. So if, for example, now maybe you are in 400 level or maybe in 500 level, and the accreditation of your school expires,
the thing is, you just have to be patient until your school finalize and finish with the accreditation process before you be inducted, because that's only when the board can even come to your school to do what induction and give you your provisional license. So let me take you to the thing for you to select now. In internship, for you to have a good internship here, you have to make a proper selection. And one of the things that you have to look at some things before making your choice. One thing is the accreditation status of that particular center. And I told you, and I said earlier that you can get the list of accredited centers from the board website. Now, even when you go to that board website, each center has their duration of accreditation status. You see some hospitals, they might say, okay, within 2 years, like 2022 to 2024, some 2022 to maybe 2025. So you can see the accreditation status. You can also know the number of interns. So in that way now, you can actually look at your chances of making it in a particular center. Because I think if a particular center has more slots, it means you stand higher chances of getting internship in that particular center. Though some centers are more competitive than the others. So now, if you now want to, aside checking the accreditation status of a center, one other thing to consider before making your choice of intern placement is availability of modalities. The thing is, for you to learn well, when most of us are in training, our institution might not have some of the modalities. Like, you see some people, like, you might finish your radiography program without seeing the MRI machine, without seeing the CT machine, right? So now, in your selection, you might actually try to say, okay, let me choose a center that has this modality. Maybe a place that have MRI or a place that have both MRI and CT, maybe nuclear medicine, radiotherapy, you get. I have a colleague now, for example, we chose the University College Hospital Ibadan. We actually chose the same place initially, but when I got at UITH, I actually resumed. So before they called us for interview, I was 3 months in UITH. So I never wanted to start again. So I just left UCH. But UCH is like a very good place to do your internship because you have the option of seeing nuclear medicine, radiotherapy, and your normal diagnostic radiography, where you have your CT and MRI. Now, let me take you through the application process. For you to have a very easy free application process for internship, you have to gather some documents. There are some documents that you are supposed to gather, like that will help you in the application process. The first thing is your provisional license, which you'll be given after your induction or doing your induction. You'll be given your provisional license. You also need your notification of school results. Notification of school results. Once you've completed your degree too, you get your result. You need like your indigenship letter, that's showing your state, now your state of origin. You need your birth certificate. Then most hospital will always ask for recommendation letter, at least three recommendation letter. You'll be also asked to write an application letter, then CV, then passport. So I think what you will be needing, you need a provisional license, notification of your school results, your internship letter, your birth certificate, 3 recommendation letter, application letter, your CV and passport. Now, some center will ask you to pay application fee. Like, you have to pay for you to apply. You pay after making your payment. That's when you can now fill and submit your online application. Then there are some hospitals that you still have to do physical submission. Like, after your online submission. You still have to print some of this your document and take it to the hospital and submit. Now, after applying, successful candidates are shortlisted. So once successful candidates are shortlisted, some hospitals will take you directly, but some will still ask you guys to come for interview. So in that interview now, what they are asking you to do is they will be asking you common radiography, basic question in radiography, like maybe radiation protection. Like in our time now at UITH, what they were asking us was just about radiation protection. So obviously it is something that is very, very easy. Oral assessment, like some they will interview like orally. You should like very, very simple radiography questions. Then they will check and verify your document to be sure that all your documents are original. Then they will shortlist the list of successful candidates. Now, in some facilities, after shortlisting successful candidates, they will ask them to go for medical checkup. They after checking them medically, then they give them their appointment letter. So in the internship also, one thing you have to do is you have to know what the internship is all about. It's about giving you idea of what the nature of work you'll be doing as a full licensed radiographer. So you would have to be operating the machines independently, attend to patients from pediatrics to geriatrics to road traffic accidents, non-ambulatory patients. You do that independently. And when there's always a mistake, you have your senior colleagues that will always put you to. Then there's always this patient interaction. So there are some of us that maybe, for example, now you might not get internship in your own what do you call it, in your own area. Like maybe, for example, now you study in the north and you are coming down to southwest. You know, patient interaction might be a bit difficult for you because you always want to communicate with your patient, and your patient will, it is the local language of that particular state that you are in that you have to speak. So like we have many easterners, like some of our people from the east that they finish from the east, they will have to come down to southwest. So you see them trying to communicate with patient because obviously patient communication is very, very important. So you learn their language and that. Then one thing I should mention is in the internship there is a compulsory professional course that you're supposed to do, which is known as the PGC, postgraduate diploma course. So you would have the option of choosing between CT and ultrasound. Either you do PGC in ultrasound or PGC in CT. So if you are someone that feel like, oh, I like to practice as a radiotherapist in future, so obviously PGC CT would be preferred. But if you feel like, oh, maybe normal diagnostic radiography and you like sonography, just do your PGC ultrasound. So once you are doing your internship, it is where you are going to make your choice of where you want to practice fully. You see how radiography is, you learn radiography, you know that, oh, okay, this is the modality I like very well, and you would build up on that. At the same time, radiography is more like you have to make a decision whether you want to be in the academics, you want to work in the clinic. So in your internship, you should be, how will I put it? You should be making that long-term decision. Like, that, oh, I think I would like to practice, or okay, I think I would switch to what? To academics. Then you network too. Internship will give you that avenue to network. You meet with radiologists, meet with radiographers, you meet with other professionals from other levels, like even with surgeons, because like we now in UIT, you go for CM duty. There's theater radiography. So you meet surgeons, you meet with different kind of people, and you connect. So that's what the internship is all about. Thank you so much.
Thank you very much. We appreciate this session. Currently, can you hear me? Sorry, can you
I
hear
can,
me? Okay.
I can.
Okay. Yes. Thank you very much. As of now, there are no questions. So I really appreciate you coming over to educate us on internship and the life and even the PGCs. It was quite an enlightening one. Thank you very much. Really appreciate it.
You are welcome.
Yes.
Thank
Thank
you.
you.
Mic stop working.
Yeah.
Okay, the mic stop working.
The mic has to work.
During the really made the decision and you know that you on the way. Thank you. Let's appreciate that. Okay, hello everybody. My name is Dokas and talk about Ayo Musa. He talked about supervision, a senior radiographer to prepare the radiography graduate. So he also said that when we are doing our internship, they'll give us a provisional license.
Then after the internship, get the permanent one. He also made mention of the board that when we want to do our internship, that the board would offer list of applicants. Then we can now pick the one we want. Talked about things to look for when we are doing our internship. He said we should look for a center that is accredited. He also said we should look for the availability of modalities. He also made mention of the application process. He talked about the things we will need to apply to get our internship. Then he also said something about PDC. He said that is the compulsory course we do during our internship, and would decide on the modalities we want to do. And yeah, and I also said during the course of our internship, would then know how the modality we want to delve into, and we're able to make long-term decisions. So thank you.
Yeah, thank you. Before I give the next person, Mike, I want us to appreciate. Let's appreciate the presence of the college president, Comrade Oladimeji Sadiq.
Okay, in addition to what Rad Musa Adebayo said, he talked about accreditation of the school that you want to study in, and they renew the accreditation. He also talked about things to look out for before making your choice in internship. You must make sure that where you want to do your internship, there are machines available. If you want to specialize something, make sure that they have the machines available. And he also talked about the accreditation status. Thank you.
So, all that has been said. Yeah. 100 level student. Nobody. 300 level. Our seniors. Yeah, thank you to the students that spoke. Yeah. Conduce for you guys.
Good afternoon, guys. Yeah. So I have few questions. Can I radiography? Can ALARA stands for the please answer me. ALARA, what does it stand for?
Yeah. Sorry, can I answer the question?
As low as reasonably achievable. No one. Fine.
Please explain to use your English chamber. This one is not working. I don't know. Your audio is not working.
I want to engage us in one fun thing now. So I need volunteers. Yeah.
Thank you very much,
There's a reward if you are
Adebayo.
able to
There are currently no questions, but then
You
we
come
try
out
to ask
first
if
now.
people learned from what your session, and by the responses,
And
there were quite
the
a lot
reward
of
is
people
very
that learned a
huge.
lot of things. I'm sure you heard some of
Yeah,
it.
yeah, yeah.
Mr. Samuel, can I hear you?
Okay, can you hear me now?
Yes.
Okay, so I was saying that we tried to ask people what they learned from your session, and I guess the mic was on, and they were able to answer and tell us what they learned. I'm sure you heard that part of when each student were answering based on what they learned from your session. There's basically no questions for you. Thank you very much.
Yeah, yes. I had that. Thank you so much. Thank you so much. Thank you for having me.
Yes, you're welcome. I will reach out to you on Twitter.
All right. All right. Thank you so much.
Good afternoon, sir. Dr. Dambili. Good afternoon, sir. Hello, sir. Can you hear me, sir? Hello, sir. Dr. Dambili, sir. We cannot hear you, sir.
Yeah, I can hear you.
Okay, sir. So we are ready for a session now, sir.
You say?
We are ready for a session now, sir.
Can I share my slides?
Yes, sir. Yes, sir.
Distinguished colleagues, I have called for the end of this meeting. You go out of this place, all of you. Okay. Can you see my screen? Hello, can you see my screen?
We can hear you, sir.
What about my
hear
screen?
you.
Can you see the screen?
Yes, we can. No, we cannot see you.
You can see the screen, Abby?
You can't see your screen yet, sir.
Hey, can you see my screen?
No, we
cannot
can't
see
see
your
you.
screen. Dr. Dambele, we cannot see your screen.
Okay. Oh.
Tell your voice now. Not
Sule is there. Shehu is there.
I can see my show. I can see Sule, my boss.
My president, sir. I am very loyal. That is my director talking, sir. Shehu.
I can see that. This is FMC connection.
I didn't know we're part of the speakers. Nice to have you here, sir. These are your two students. They are doing well.
They are doing well. They are doing well. Can you make me part of the admin so that I can share my slides? Mariam.
Yes, sir.
Can you see my screen now?
Yes, sir.
Yes, sir. Okay, good. Is it afternoon? It's afternoon. So I have just like 10 minutes to quickly do this presentation. Ladies and gentlemen, I want to congratulate you on the symposium you are having. And I want to tell you that the Association of Radiographers of Nigeria are with you. And we are ready to partner with you at all time. And we're ready to support you at all time, knowing fully well that you are the brain behind, you are the future of this profession. So we're going to quickly look into the area of exploring the industrial aspect of radiography. I want to tell us that radiography as a profession has gone beyond the hospital setting. Radiography is a well-diverse profession, a profession that has so much enemies because of its technological advancement, its areas of prospects, and the glittering aspects of medicine can never be emphasized without the mention of radiography. And that is why, if anybody campaigns and he says, I'll give you a state-of-art facility in the health sector, the only thing he talks about is the MRIs, the CTs, the nuclear medicine. However, today we are transcending beyond the four walls of the clinical setting. We're going into the non-medical imaging aspect of radiography. And that is the industrial aspect of radiography, which is a non-medical imaging that has to do with inspection, that has to do with quality assurance in engineering and in security. What is industrial radiography? Industrial radiography uses X-rays, gamma rays, and other forms of ionizing radiation to inspect materials or structures non-destructively, invariably. We can decide, just like in medical imaging, where we can do cross-sectional imaging without opening up a patient. We can see the liver, we can see the gallbladder. The same way, we don't need to crack any pipes. We don't need to uproot or to damage the grounds before we could know whether there is an oil somewhere, where there's a crack somewhere. This method is in use. We don't need to destructively get into an activity before knowing what we have within. It ensures integrity without damaging the object, and it's a key tool in many engineering industry. Well, where are the key applications for industrial radiography? It's basically used in weld inspection in oil and gas pipelines. It's also used in aircraft and automotive part evaluation. It's used at the airport and cargo security, examination of artwork and artifacts. I can tell you this authoritatively as a radiation safety advisor. I have in many scenarios and many times been involved in consultancy services at the Federal Airport Authority of Nigeria, where we were able to advise them on this screening and radiation protection with respect to the application of the radiations, either for security purposes, medical purposes, or other industrial purposes. For example, for directions of flight, we use radiation, and we use this aspect of radiography to direct and redirect flights at our various airports. We also use it in the examination of artwork and artifact. For those of you who knows a profession called archaeology, the archaeologist uses this means to examine their artworks and artifacts, to even determine the numbers of years an artifact has been. For example, there are some artifacts that has been seen or artwork that have been discovered. And through this process, they can easily say, this work we have seen has been on ground since 5000 BC, since 2000 years ago, since 10,000 years ago. They can easily tell us from this methodology. What are the equipment and radiation sources that we use in this aspect? We use gamma sources like iridium, we use cobalt, we use americium, we use intam, and we use all these. We use portable X-ray generators, CRDR imaging system, radiation monitoring instrument, and so on. We use both artificially, most especially artificially generated radiation. But the reality is that when you are doing all this, if you don't involve the optimization protocol, just like we use it in medical, there will be problem. I give you a scenario where I was discussing with the engineers that were working at a particular section of the airport. And I was telling them the radiobiological effect of some of this radiation. And immediately after my presentation, virtually all the engineers that were on seat had to testify that they were involved in one or two scenarios that I painted out from my presentation, ranging from fetal anomaly, ranging from primary and secondary infertility, and going into radiation-induced accident and hazards, going into the level of deterministic effect of radiation. All these things were on the front burner in the course of my interaction and interfacing with the engineers that were on the field. So it goes to show that as radiographer, you don't just breathe in and breathe out within the clinical setting. You can easily extend your tentacles to these areas of endeavor. These are lucrative areas. They are areas that when you hit it once, your life will not remain the same, just like Sule will say. So you have to do, there's what we call higher, in the industrial aspect of radiography, there is higher exposure risk compared to what you use in medical radiography. In medical radiography, you basically use the kilovoltages, the millicuries, but in industrial, you'll be talking about megas. You'll be talking about the entire, and in billions, in millions of voltages. This is what we use in the industrial setting. You need to have what we call a strict adherence to the IAEA and the NNRA regulation. You must also put on your protective jackets. The warning lights must be there, just like you have in the medical setting. And there must also be proper training. And that is why those who are involved in industrial radiography, currently in Nigeria, we have a training institution called Nigerian Institute of Radiation Protection and Research, where they are being trained on how to protect themselves and the facility from the hazardous effect of radiation. The same way we apply optimization in medical imaging, we do apply optimization in industrial radiography. However, you must be well trained. You must have gotten all the prerequisite qualification before you could apply this, lest it will be termed a dangerous practice. What are the career opportunities? In industrial, you can decide to go into that area. All you need to do as radiographer is to take some courses in industrial radiography, and you have hit it on the head. Ladies and gentlemen, by the time they will see you next time, people will not know the difference between you and your pozuna, because you have gone into an area that is very, very, very glittering. There is what we call non-destructive testing. That is what we call NDT. There are some that specialize in that area. You can also be a radiation safety officer in that environment, where you guide, you institute, and you earn a practice. It is also, you can also specialize in, you can also work in oil and gas section, in the aviation sector, in the security industries. And that is why some of us, we are consultant to the federal government on nuclear security. We have some radiographers who are being employed by the Office of the National Security Advisor on nuclear security. And that should let you know that radiography is not about missinu, misita, say me. No. Radiography has gone beyond that level. And it requires certification. In conclusion, industrial radiography is dynamic, it's well-paying, it's globally relevant branch of radiography. Radiography isn't just about patients, it's also about pipelines, planes, and progress. Thank you for listening. The references of this, my presentation, is from AI and some documents that I was able to put together. Ladies and gentlemen, thank you for your time. And I must apologize that I made this lecture very short, because as I speak with you, I am in the middle of an emergency meeting. I've just taken some permission. Thank you all for coming. Thank you for listening. And I hope in the course of your deliberation, I get to see some of your resolution that will be so impactful that I can use and we can use for the generality of radiography in Nigeria. Thank you and God bless you.
Thank you very much, sir. We really appreciate you. Thank you, sir.
Thank you, everybody. Can
Yes,
can I use this permission now to take my leave, sir?
Yes, sir. Yes, sir.
Thank you so much. All the best. I wish you all the best. I can see the class. Man, this class is full. Oh.
Sir.
That's good.
Yes, sir. Thank
you,
much.
everybody. All the best.
Yes, sir.
Now, we need to understand that as radiography students, academic work, school work, academic theory, and clinical practice are very, very important and vital for you to be a competent and confident radiographer. But the problem now is, as students, we do not know how to combine these two together to be well paid. I don't know if you understand me. Now I want to talk to us with experience, like I'm going to use my experiential life, my experiential ladder to talk to us. I'm not going to come with any book work or any good theory. I want to use my own life scenario as a case study. Now, you need to understand that what makes you a competent medical radiographer is the ability for you to combine these two, academic work and clinical practice. But most time, we are being overwhelmed with the academic part only, in the sense that you want to focus on reading, covering the handouts, covering the materials, the slides that your lecturers have released, forgetting that the other one, which is the clinicals, are also important. And I want to correct that notion, because in as much as you want to cover all the slides, you are the book type, you are the bookworm, you are the, because that time in school they call us profile. Yes, it can also be good theoretically and be good practically. You should know that graduating very well. Yes, graduating very well, coming out with first class or at most 2-1 should be your utmost priority as a student. And you should know that clinically too, or practically, otherwise, you should not be found wanting. I remember when I was in school, it was just a chief, a senior colleague that was still in school then. He was like campus fellowship president. It was in the final year, I was in 200 level. It was the final year. Because I was close to him, he just started me down one day and said, guy, you see this profession, you have to start it early. I didn't know what he was saying, but he gave me a beat. Now you need to understand that medical radiography is different from medicine and surgery. It's different from nursing. It's different from pharmacy. It's different from other staff-related courses. I will explain why. I see medical radiography as one of the fittest. It's master of all and know it all. What do I mean? In our sister course, like medicine and surgery, these people, they have the time frame that they go for different posts. Maybe 400 level, they go for what we call baby catching. 500 level, they go for O and G. And then they have different times that they expose them to different areas that they should know, including the nursing and other developments. For radiographers, it's not like that. What do I mean? You can see someone who is in 300 level already knowing how to scan. The person has let handling grow. And you who is in final year, you don't have any idea of ultrasound. When there are job opportunity, they will look for that person who knows how to scan, who knows practicals very well than you who is in final year. I remember back then when we were in school, our PTS, the best graduate students, it was not finished when he was starting internship for those in final year placement. That was when this guy was struggling to go and learn how to scan. That was when this guy was learning to do specials and the rest. Like some of us who were already acquainted with these things, we already had job waiting for us. Like they were just waiting for us to do our defense of he was there. He was even pleading and begging me to take him along for local drugs and the rest. Why? That is the time this was then that scan. But yet he was the best graduate. Yes, he was in BGS. Yes, he was very well, precise. But there's always an edge. And what is that edge? What can you offer practically? What can you offer clinically? Yes, read very well, cover your books, but always remember that it is even the practical sense that will help you understand theoretically. What do I mean? I take with some little demonstrable we will do a little test. I was told just 15 minutes I am. Where are the 200 level students? Present I need 2 persons to come forward. 300 level students. Please, we are family, right? We are all radiographers, whether you are students or out of school, we are all family. So don't feel intimidated. These are the 200 level students. Can get up. Please let's clap for them, my sister. Three hundred level students, none of them here. I think I know one. Where? Please let's clap for one action. So who will be doing the quick walk? I want to see those. You know, they tell us in school that time that when you're 200 level, going to 300 level without any business with posting. That's what they told us that time. They told us that don't go to trust and community or seniors. So back with connection, back with chatting and other physiology and the rest. That was what they told us. Some of us knew that it was not just about that. Yes, you have to read your paper pencils, you have to read your head and neck and cover. You know that they still doing that. So some of us we had that sense, even though we were already going out for post. Yes, teaching us to rejected us. In fact, let me tell you that some of the disadvantage or some of the negative effects that might discourage you is rejection. Just know that they will reject you. In fact, your fellow radiographer will reject and say, please, I don't want students in my center. Hospitals will tell you they are not accepting students. Yes, but I tell you, don't be discouraged. Keep on pushing. It happens to me. It happens to me. I remember when I was trying to do my ultrasound, the fellow radiographer asked me to pay 100,000 to teach. Understand? So that is the challenge we face in this profession. Radiographers are not interested to train others. They are just focusing on the monetary term. Or they even see the other ones as a threat. That was how that guy saw me. But don't be discouraged. Keep on pushing. You go to this hospital, they reject you. Go to another hospital. If you have to travel. Don't stay idle. During holidays, that is not the time to go and watch movies. That is not the time for you to say, let me rest. I've read much. That is the time you have to go and raise up your clinical forever. So what I want this ones is that they are the junior colleagues. They are the younger ones. I don't know what 400 but at least these ones, 400 or 500, these ones are the ones that are already been exposed to the practicals. But what level are you? 200, 400. 200. So why I call this is that? Why I call them this? I want to see the ones who, on their own, are making effort for clinicals. Why am I doing this? Now, if for example, this is my sister here, she's 200 level, but she has already started clinicals. She has had the opportunity to go to a hospital and she has seen when they do chest X-ray, right? The person that was presenting was talking about the missing and theta. She has been able to see that how to breathe in, look at the position and the rest. And this my brother hasn't gone to the hospital to witness anything. Then, for example, the lecturer comes to class the next day, checks X-ray, the position. Between the both of them, who do you think would quickly coordinate what lecturer is teaching? This one. Because she has seen this matter, even though it's just once. When lecturer will be reading book, like she will be presenting the patient stand against the cassette holder or the red body with the arms length and shoulders shown up. So we'll be doing book work, just like she has seen it. Standing against the cassette holder, showing up the shoulder to make sure the scapulars are not in the field of interest. And if she goes beyond just acquiring the image and seeing the image, she will now see how chest X-ray record looks like. Why this one is still struggling? I don't know if you understand me. Now, if she gives opportunity to meet with a radiographer that is good or the reporting radiologist that explains what is inside that chest radiograph, you'll be able to know that when you breathe in very well, there should be numbers of anterior ribs and posterior ribs that you see. She knowing that she can't relate. You see that she has gone far. But this one is still trying to even know how the positioning is. I don't know if you understand that. Now, let's say there's an RTA case. And this patient is on ambulatory. This patient is non-moving. Please, the timing is. She has also seen the opportunity of how to do modified view. Because this time around, we are not going to do the basic view of the posterior and anterior. Two of us, we do it patient to find. Now, you will also see that the pin direction will change. When you do a posterior anterior, the direction of your pin should be horizontal. But when the position changes, you see that you have to change your treatment. Now, she will easily understand this thing. But the other persons that you now see how practice would make you understand the theoretical work very, very easy and better. Are we together? Now, let's say even on ultrasound other areas. I just want to class. I am a lecturer, and she has been going for posting, and I just saw that image, and I project this image. And let's say she has been opportunity to go for an ultrasound class, practically, and see this image. You know, our cognitive reason we start trying to recognize this pattern. In radiography, what we do is pattern recognition. What we know. Pattern recognition, because this is medical imaging. She has been able to see this thing before. So when the child goes on and hang this thing on the wall, our pattern, like our brain will try recognizing this pattern. I've seen this image before. What does it look like? But this ones, for example, that haven't come for posting before, they will be thrown off balance. They will, what is this? Are we together? Then the lecturer will say, this is an embryo already so traditional with a kind of length of so. And he will go to the extent of trying to tell you, you measure from the crown to the rump. That's how you measure. Now they will not know what the crown and the rump will be. Because it's theory work. Lecturer is not dictating. It's just lecturers that will show you images these days. That will come with radiographs, that will come with image slides. Some will just do qualitative work for you. If you like, go and make research. I don't make research. I don't do the lectures. Now, because she has seen where they have made the caliper. Are we together? Can you see from there? Can you see? Now, you see where they place the caliper from the crown, which is the head, to the rump. The longest, that is the length, they measure down. You see that she's already getting edge over there. Are we together? Now, I will just make that a simple a simple accessory for them. You agree with me that if you've not gone for posting, you wouldn't know what this is. You agree with me? So I want to ask them, what is this? Anatomical marker. What is this? Have you seen it practically before for posting? So you now see how practical radiography helps with theory work. Just say, for example, the lecturer just come and tell you when you are doing chest X-ray, always ensure that you place your marker. Always ensure you place your marker. When you miss marker, your work is not correct. What is marker? Is it writing marker? Are we together? Then because they've seen marker, they will know that this is what the lecturer is talking about. And not just the marker alone, they will know that we have both the left side and the right side. Am I communicating? So, in fact, when I see my younger colleagues, I take them to her because I know what I pass. I know what I pass because even the consultant radiologist, I keep telling my students, because the consultant radiologist have taught me how to scan, not even the radiographer. So, not trying to use anybody to pave way for you. The most important thing is that don't give up. You will face challenges. They will tell you, don't worry, we'll get back to you. I know about 2 or 3 centers that told me, we'll get back to you. Today, they not get back to me. Praise the Lord. I'll get back to you today. So we're even waiting for money, so we're waiting for wine and the rest. But what joy do you get when you need that party to someone's life and you miss this? Are we together? Please, let's start from the So the importance of clinicals or practical can never be overemphasized when it comes to making a well-baked student. I said I will be talking based on my own experience. As for because I started practical earlier. Some 300, in fact, late 200 was already going to ultrasound. I was already working with senior chiefs. I was already scanning with senior radiologists. So as from 300, 400, I was already going for cover jobs. I finished from University in Oka. But I will tell you that I was from school. I will go to Bayelsa for cover job. I will go to Benin for local jobs. And trust, they pay per day, so you just charge them. It can be 10 per day, and any amount based on your experience and based on numbers of patients you see. So you can see that even as a student, practical can start giving you money. Are we together? Are we together? So it's just for you to be serious. That's what I tell myself. Seriousness is just what you need. I will repeat it. Photography is not like the other profession. These people, they have their time duration. They have when they go for this course, they have when they go for this course. But you, even when you're 400 level, you know so many modalities they will go for. Do you understand? If two persons apply for a job and one knows only X-ray and scan, and the other one knows make X-ray, explain radiography, that was not ultrasonography very well, that one knows CT, and this center has this modality, who do you think they will go for? Be sincere with yourself. Who do you think they will go for? The one that can offer more than that, because as a businessman, you want to maximize profit. Even if it's for you to top up money for that person, you will retain that person. So you can see I'm trying to challenge you now. Don't say that it's small. It even gives you joy when you start early. So that when the lecturer is teaching, it will not be abstract. Do you understand? It will not be abstract because I was already doing practically. I had like 2 to 3 jobs waiting. Even before I went for before I got my license, the temporary license. Because once you graduate, you give temporary license. It's when you do your internship and not give permanent license. So before my temporary license came, I had 3 people. Why? It was based on recommendations. Just call this one like I did. I got it like I did. So I don't want to waste your time. You should know that the profession is you are vast. The question is, thank God for the person that talked about the industrial aspect of photography. Photography is fast, it's broad. So it's good you know these things and think that's your niche. And again, don't be intimidated by your sister profession. Do you understand? Never be intimidated. Don't say this medicine guys and you feel you are superior to them. Don't say the commerce side. No. In your own field, you have to be good. Because they need you, they need us. Are we together? And when they see who is good, they give them respect. They rush them. They don't look you as a subordinate. They know this people knows this thing. In fact, they seek your advice, they seek your opinion on some things. Are we together? So, the importance of clinicals. I'm not saying you should leave your book. I'm not saying you should leave theory work and just do it. In fact, both of them work hand in hand. You cannot be a good sonographer, you cannot be a good radiographer with that. In fact, there was one of my lecturers in school, Dr. Wuguna, a prof. They are not calling me, he says, a statement, he says, the radiographer, without the knowledge of anatomy, just a photographer. Are we together? A radiographer, without the knowledge of anatomy, just snapping. Sometimes this patient, they expect to tell them what is happening to them before the journalist report comes out. So it's paramount that you even know what you are doing. It's paramount that when you do an X-ray, you should know what is happening in that patient's body part before the journalist report comes out. So I can say you know that I also see yourself as a radiologist. Because your work is not just to acquire and pull. And when you know pathologist, when you know anatomy, it even gives you guide on how to perform well and satisfy the radiologist. Are we together? So you can see that both the theory work and the practical work is very important. They are hand in glove. When you read, you understand what you are doing. You are not a technician. You are a technologist. Technologist answers the question on how. You need to know what you are doing. You need to answer these questions. And that's why you are different. And you should know that you deal with both the physical aspect and the human aspect. You know, the physical aspect is where your machine comes to play. Then the human aspect, that is when you operate on your patient. Are we together? So even if you know how to do this thing, alright, thank you. So that 5 minutes. So even if you know the basic positioning, you know all the things, but you don't know how to handle your machine, you are still that's not doing anything. And that's why there is a special course they put neurologists. You need to know how to handle your machine. Because even these machines are helping produce optimal images. Do you understand? If you don't know how to do these things, even when you have the technical know-how with you, if your machines are not optimal, the images you produce is optimal. Are we together? So please, 200 level, 300 level, I am here to make you understand that it's not late. Sorry, it's not early to start. Okay? When you travel, those of you that have opportunity, even if it's plain X-ray, go and start something. Even if it's ultrasound, go and start something. I tell the final is that if you are here, you don't know how to go through. Final year, you not start there. Because ultrasound is what will give you little more effects before your internship and that comes. In fact, there is no center that will function without ultrasound. They might have X-ray, but see that ultrasound. I'm talking about the small center, not like all these big hospitals that have CTM. How many people are buying CTM? How many people are buying them everywhere? The small ones that can afford to, it's ultrasound. So even if you are at 400 level, you don't have those kind, you are 500 level, you don't have those kind. You're already one way. Make your money. I remember when I was in school, I was already paying like this. My parents were paying like this on 300 level. I was already going for cover job. So the money was coming. I would pay my house rent, I would pay my school fees. Even my project, I asked myself, my mom was amazed, this boy. I said, don't worry. When the money is coming, what do I need to? Sometimes people send them money. In school, because of practical, because of clinical experience. And I think I did well. I think I did with 2-1. Nobody went with first class in my scientific PGS. So you can see that it's very, very, very important. Thank you so much. God bless you. Let's jump our heads together for our wonderful session. We will have a panel session, but before then, I would like to invite our distinguished guests for the come up here to speak to us or give us advice. So I'm inviting Raj Adinamola first, and when she's done, she will be very advice. So thank you. Please let's jump on this together for. I'll just say actually nice and it's amazing. Not because your clinical aspect is very, very important. That's the aspect. So you know what as a student as not like anything you don't know, you don't know to discover. So please not you don't ask questions. And you can let that person but yes, know what you're getting. Ask. When you do it, you ask questions. Because in the time when you don't know a question, when you are doing one day, nobody will ask. And you want to know really bad, that's what you're going to know. So whenever you find yourself, just know you're going to that. And you know that you're going to that. And like what you said, ultrasound, again, outside of according to me, outside of so make sure that you have the student, go for the sound posting, and you too, you can get very faithful information from the student. So when you watch, also I'd like to call on Chief. You guys snap on. You snap on. I want to appreciate everybody for inviting me. I was given 5 minutes, and I want to start the argument by picking from what our first speaker said. And one of the challenges we have as senior professionals, not all of them have trained so many people in sonography. I've not collected the time. Are you happy? I'm not the one encouraging them. Some of them there, some of them are practice. All I just wait for one day, he said,
Thank you very much. So, right about now, we'll be moving on to the panel session. Our panelists are here already. We have Raj Jaffet. He's principal videographer and city specialist at Oshogo Central Hospital. And also we have Chief Odedele Akintayo. He's currently a principal videographer at Osho State University Teaching Hospital. And we also have Brad Adedamola Jenema. She's an intern of the Osho Teaching Hospital. And I'd like to bring up on stage the guest moderator for this session. I think you should get already. That's how you look at this popularly known as Rockwell. Let's put our hands together, please. We can do better than that. Please let's continue on to the air of seats. Right, their stages. Most of them, everybody knows to school. So, I want to take it slowly in go into practice. So, my first question, I will direct it to the first panelists. I will direct it to this side. Direct it to this side. Alright. So I would like to ask you, what's the most valuable lesson that you learned during your years of school, your radiography training, that really helped your career? Just a message that you learned. Most of us, when we go to school, there's something that we teach, okay, this lesson. And funny enough,
When I'm talking about career, it might not even be an academic place that you get per se. It might be just something that really stop while you were in school and just change your career later. Thank you, sir.
If I want to, I think it's self-learning and self-reliance. I really think this program. People think ultrasound is difficult. Nobody taught me ultrasound. Nobody taught me ultrasound. Nobody sat me down and said, this is how it is, this is how it is. But it was later I started studying. I have this issue. But someone was sitting there and tell me this is it, this is it. Also, that experience from school, I love reading, I love researching on my own. Because I'm such a person that it's very difficult for me to access something.
So you are saying that most students they have a problem with not most of them don't like to rely on themselves.
Students don't need anymore.
Okay, so you can hear what he's saying. He's saying that what really helped him shape his career is self-learning. Most of us cannot take the body for ourselves. Am I right, sir? To learn. That's what you're saying, sir. Thank you, sir. I really appreciate your response. To the next question. All right. So, what do you wish your education has focused more on? What do you wish you focus more on while in school? That would have helped you get that. It's different from the question I asked. But this time around, I'm not saying your personal, what you did personally, what you did in school has done more. That would have helped your own transition, like living through and going into practice. Yes. Clinical posting. Alright, she's saying that with the school, she feels like the school should focus more on house. So that's very interesting. It's a round of applause as we answer this question. Please also be reminded that you can ask your questions, so write them down. You can write them down and pass it. Someone will collect it and down in case you have questions to ask. Thank you. She said something like clinical practice with the clinical posting. So, sir, I want to ask you a question, which is like a continuation of what she said. So, how do you think clinical posting really helps students into transition? What does clinical posting really do? And why is it that some people don't even think it is important? Some people skip posting. People skip posting very well, a lot. So, why do you think it's really helpful? Why do you think it's emphasized on that clinical posting? Thank you, sir.
First of all, I want to say that for photographers who are there to practice, let us practice and practice very well. Shaping your work. So clinical that enables you to transform to the workspace. And not just to the landscape. Transforming to the workspace and you are really transforming. What I mean is that when you think that's really giving you a good basis. And I don't think you will part of reading, that is it. That one is key. It's very, very, very important. One thing I know that helped me was I didn't just see myself as the other people who they see about that you just can't snap history. Just snap it. They don't see you as someone who can say what is happening. So one thing that helped me, I told myself
be a regular videographer. Not the one that you just do, you pass. The student asks you, sir, what is here? What is happening? I can't say. And you can't see anything of this case. That mentality is wrong. And that is where really comes. That is where apologies come to play. So when you are in a reading time, when you make researches, to give you an edge. Yes, sir, but more focused on the clinical part, posting. What we post for all students. What is meant for you as a student? Yes. You as a student, you should have your own personal drive first. Personal drive. Yes, you have to have your personal drive. Because even when they put this in check, to make sure you benefit. The ones that will still not want to benefit, the ones that will keep posting, the ones that still have this nonchalant and lackadaisical activities, we still be there. So that personal drive, that like you have to see yourself as important in the field, and you have a part to play. Okay. Like not just see yourself as a helping hand. Like I don't know if you understand what I'm saying. See yourself as someone who is key in this business. So that will motivate you. That will motivate you. There are sometimes where I work, we have pattern meteorologists. So even before the man reach out to the court, the doctors, they will just come out. I want to see for you. Even if I'm not going to give out another report, I'll give them pointers and say, this is this. So this man, we don't do a brain sitting for somebody who is having after some chronic hematoma and say there's nothing happening. It's an emergency, it's an alarm, so that they will know what to do. They don't just wait, they don't just cannot report it immediately. When you raise an alarm, you give them the image, they will know what to do. So that is where your personal drive. Don't just say I have to just do it and pass. They ask you what I can say I don't know. Let's say for this report. I don't know if you understand it. So that is, I really understand the question. Now we are just doing this. So if you have been following our discussion, we are saying the same thing. We are actually saying we should first focus on our own personal drive, self-learning. Then she also mentioned clinical posting, and Rajate emphasized on how you can make it together. They go hand in hand. If you are teaching your clinical posting, and you yourself, you are not even in for it, you won't gain anything from it. So thank you very much for your response. To the next question to Raj Akin. You mentioned something about self-learning. So I'm not going back there, but I want to ask you, along your journey, are you saying you didn't really have any mentor or instructor to guide you along the way? Or if you had, what was their role in really helping you in transition? Because most of us, we don't have anybody that we look up to. I just give you, I just go in. So nobody is even telling us that we need school, okay, this is what you see. I was speaking to one guy one day because he wanted to do internship. Yeah, he was not able to get placement for like I think 2-3 months. And I was like, this is how really working. I even felt like I used to say that there's market. I mean there's opportunities out there for videographers. So for those of us that don't know, please let us start. Is this important that we have mentors or instructors that help us? Thank you very much, sir.
Well, I appreciate that question. One of the things that affected me was not having mentor until I took some steps. But this kind of gathering is essential for those people that are coming up. I did tell you I don't have a mentor. And you cannot go and tell your mentor to do 3 things. You look at it and say, is this one normal? What do you go to school for? That's how I'm saying.
I get it, sir.
For example, the other side I give an example. In school, they taught you physics of what is right? That's right. They taught you physics, they taught you the other parts. You know that most people don't do that when they graduate. Most people cannot explain. Even X-ray production and X-ray interaction is important. Some people cannot differentiate between the two. Yes. Your mentor will only guide you. work with big for you. You understand? Yes, sir. So when you have done 90% and you are confused, your mentor will not be power. So you is going to so mentor is very, very important. That's what I'm saying. You cannot go. Your mentor is just there. But you must be ready.
I like brother answer. It's always aiming to God. You must be ready. So if you are not able to think for it, don't even think about it. Because they are what? Always. The mentor will not attend to you. And there's even something I learned about mentors. Mentors, you don't even pick a mentor. The mentor should pick you. The mentor should know you are actually ready to go. Let us just bring this guy along. So thank you very much for the answer. So now we'll be going more deeper and deeper into the question. We have left the education part, we have left the school part. I want to talk about job experience. We are talking about practice now. I want to talk about job experience. So, Ma, I would like to ask, after leaving school, like, what was it like to get your first regular job? Like, how did you go about it? What was it like? Because in like a brief summary of things that you did, how it was generally. Thank you so much. Okay, after internship. Okay, let's talk about internship. Let's talk about internship. It's what is one. Okay, okay. She can be here like this. What is it? I was just thinking that now that I had to think that was okay. That's one. Yes. Okay. Good. Yeah. Um, wow. That's thank you so much, I really appreciate the response. So, please, my people, you have heard it. You have to really, really connect. They are telling you, see, anything they tell you here is your fact. Just take the way they say it. just what take it the way they say it. So she has shared her experience of how she got internship. Sometimes your qualification might not, you have to know somebody that knows somebody. So you can't sit back and say, okay, I'm doing things on my own, I'm on my own. You must make, it's even part of, I think it should be a part of the job requirement. Because even as a videographer, you must be able to just relate with people. Understand? You need to relate with people. Thank you very much for that, sir. So I would like to direct this question to this sir. She mentioned something like when she went up to an interview, right? Or something. So in the case where any of us here, we have to apply for a job and there's an interview process. What are some of the things that you feel like okay, it's peculiar to this profession as a videographer? What are these things that we must get or we must do during that interview process to make sure that we are other people that are applying? You know, our job is to do this job, the qualification is there, but we also have this. So what are the things that during the interview are unique? Just give us a quick. All right, thank you so much. In life, nobody is an ally of himself. Everybody needs themselves. Understand? So they keep saying that information is power. Information is power. And it's a key factor in life. She has said rapport with senior colleagues. Yes, that is a very, very key thing. Because if you don't make this, you don't make this relationship with your seniors, even in school, for example, when you're in college and you have first time contact, you know, once you have that problem, you take one hand out. Ask them for guidance. The ones that were smart, you ask them this lecturer, this course, what is the pattern, how does this man, is it OBJ? Because this person has passed through this thing, so you now see how relationship with senior colleagues help. So for job interview or internship, we are not here to scare you. You understand? The Bible says time and chance happens to everyone. You don't need to have the negative part. Where I did my internship was a very, very key place that when I did it, it was where she said you to that place is one of them. But I got my internship there, I don't know anybody, I don't pay time, I don't know anybody. I got it here. That was it. So it's just like my child, you don't need to discourage. And that boils down to you. You have to prepare. You have to be ready. Preparation means have stuff inside of you. If you understand, don't just be empty. Because even when God wants to help you, you use what you have in you to still help you. When somebody wants to help you, you also use what you have inside of you to help you. Okay? So always be proactive. Get the necessary things in it so that when the help comes, you will not be the one that will be found wanting. Just like when you have this qualification and somebody in that position wants to help you, there's no way the person can do it. Otherwise, it will be illegal. I don't know if you understand. So, build yourself, work on yourself, get this rapport with senior colleagues. You know, the outside world is different from school world. You understand? Outside is different from all these things that show people stay in the front during lectures, gathering, and that is different from the outside world. When you get to the outside world, you see the real thing. You understand what? Let's understand it. So, even the struggle for internship is not easy. Before I got mine, I finished around February. Before I got internship was around November. So the documentation. But I wasn't high at that time. Thank God I'm already doing this. I was working and getting money, like I was heavily paid. So the internship of the number was not for that. So I was still applying, but at least something was coming. I don't know if you understand. So it still boils down to work and get information. Therefore, the administration of the job you talked about, that is where the information or the reports they are going to come to reality. That is where the report. They should help you. In fact, when you are organizing your CV, you send to your seniors. they should be able to hear you, just like the guy. Yes. And the experiences you gather in school, those clinical places, those places you have traveled to or posting, they should be able to tell you how to make it in. Where areas to read on. Where being serious in school will not help you. If you are the guy that was using time, you touch every aspect of the geography, regional geography, general geography, every aspect of the geography, because the questions come from this aspect. So the fact that I'm reading, those words that are read well, you already have an advantage. Rather than you that will just get material you prepare for exam, don't go for posting, you are killing yourself. If you are the reading type, you have this voracious hunger and thirst for reading, you will go far in life. It will always give you an edge. Even during this interview, you have stuff, you have something to answer. Thank you very much. Thank you very much. That's very good. From 200 level, start. As you are doing early and then you are doing anatomy, start reading things that will help you in life.
Thank you very much, sir. Round of applause for this. So he's saying that to have an age, when you see yourself in that situation, the preparation that you had before is going to help you. The information you have gathered before is going to help you. A lot of things are going to help you. I hope you are taking notes. I hope you brought notes. You brought notes, yeah. That's very good. So I want to this. Yes, sir. What was that one thing? Something about preparation. So I want to take it up from there. Even with all the preparation that you had, what was that one thing that caught you off guard? Like when you started working, like when you just started, you just changed, you just caught you off guard. You're not prepared for it. What is that one thing? Let us learn from that experience so that everybody can learn and we can know how to avoid it. Is there anything that made you feel off guard when you started working? Thank you, sir.
Well, what we looked at was when you're a student, there's something you perceive. That are very high students, some students when they are undergraduates, they feel they do something. You are the guru in class. But when you go out there, you know, I know that I usually get problem. Because you feel you know. That is what. So I was not expecting some things like pattern recognition. When students go for posting WBS, your senior class, thought is not your thing. But when I start practicing, I discover that photography is even one of the guys is very good. So when you start practicing, you go deeper, and so the depth of knowledge was 1 2 years to balance all those things. So as I'm practicing, okay, what they're saying, this is what they're saying. So the depth of knowledge is very vast than what I was thinking. And it's undergraduate.
Thank you very much for that sir. What I'm saying in general is that a lot of people say that this coursework is killing me. It's too much. So when you start, you know this and that. It is not even anything. So he's saying that what really caught him off guard was, when you started working as a videographer, he saw the amount of knowledge he had to add. Before you can even pass a thing, you know the number of things you have to look at. So the knowledge gap from one school perspective and the clinical perspective. So my dear viewers, my dear students, it does not end at your learning does not even end at school. And any learning that you feel that you are doing too much at school, it's not even, that's what he said. He said it's not even up to what you was still doing your practice. So it still boils down to which words you read more, which as a recappers, when we want to be excellent in our field, we should work, we should do more. Thank you very much, sir, for that response. It's very, very natural. So far, I'll be asking you question, a particular question. So, okay, how did you handle the weight of working with patients
for the first time, like directly dealing with patients. You mentioned something now. You said there are times when during course that is just how many of us have been in situations whereby something will happen in the maybe during your posting, something will happen in the X-ray room, and you just be like, oh my god, if it was only me that was here, can I ever handle it? How many of you have seen a situation like that? It might be a very critical situation, or maybe a very critical kind of patient. You go just the one that say, ah, now only me can do it. I'm like, so Mark, I want to answer that question. How did you handle that? And how you done the course when it was just only you dealing with patients? What were your things? What advice do you have to give us on that? Okay. Okay. Thank you very much, Dr. Put a round of applause for that was really response. So we have some questions that we got from the Google Forms. So I'd like to add them to the questions. We have limited time now. We're running out of time. So, sir, is it possible to advance to radiology after the radiography program? So, a particular student asked this question. Is it possible to advance to? I think what you're trying to say is that is it possible to use from school? Maybe to go for radiology. I don't. I think that's if I may get the question right, like the person trying to ask if it's possible to be a radiologist after the yeah, it's possible for you. Yeah. I really think it's possible, but you have to go for MBBS and start in 200 get your Bachelor of Science in Medicine and Surgery, and you go for residency in radiology. But there are other other areas in radiography that you can do in your master's and advanced level. And for radiologists, you have to go for MBBS. Thank you very much, sir, for that response. Round of applause, please. So, sir, I have some question. So, we want to talk about like growth generally, like your professional development. So, were there any opportunities you saw when you started working, or any certifications you obtained, or any course you did to pursue your career, or is it that maybe you have our a radiography, just in there, were there other things you did become to advance professionally, like professional development? Were there other courses or opportunities generally? Can you give us an insight on some of these things?
Well, you know from what you say, telegraph is big. That's several opportunities there. Because it depends license in England. So it's a videographer, you have upper, you have senior videographer. So when they employ you as a videographer in the institute, after starting, they employ as senior videographer. From senior, principal videographer, from principal, become chief videographer, assistant director, then directors. And if you want to specialize in MRI, you want to specialize in CT, you want to specialize in ultrasound, then there's so many aspects. Forensic radiography, and next doctor, so many opportunities out there. It's only a radiography, you'll be confused. You choose sexuality. So as I went to this one says, I'm also available. Look at it.
Thank you very much. Let me ask something. Clinical is very in the situation of what we have ourselves, you have to know enough. Say in Nigeria, you want to just be a city because that's another city. MRI, nobody will employ you. So when you started for that modality, it's outside. When you travel abroad, you cannot say specializing on this. And they play based on where they are outside. So for Nigeria, try create fast. Fast, that's the road. Fast. The local thing is like I said, very, very broad. Solutions, broad, like it's broad and interesting. So just know so many things and get your money. Thank you very much, sir. Please, another applause for both of you. So, because we're running out of time, I just want to ask the last question, and I'm directing it to Bar. And the question is this. So, I want to ask about your work-life balance with videography generally. Like, when you started working like videography, how do you balance your videography with your work, with your personal time? And also, how do you manage your schedules? There are sometimes that you have night shifts, right? There are sometimes that you go for calls. How do you balance it with your own personal life? And what advice can you give graduates now? Graduates now. What advice can you give them? How do you manage that? Thank you very much, ma'am. That's the question I have for you. So, are you saying that really, like, some of us now, some of us have some business that even as I in school, some of us they think that even when I start the program, start working, now I'm joking. Are you saying that? Okay, so this is what are looking for. Prepare yourself. It's not easy at all. I think it's copy based on as friends and now we should look at as a student, there are times to learn and learn very well. You shouldn't be expecting rest, like much rest. When you are a student, 8, 10, or even I don't know anything called that posted to the easy center. These are stages that build you. Like she's being the ladder. After you finish NYC, then I go like senior level. Then, internship, NYSC, it's time for you to see yourself. So yes, especially it's compulsory 1 year program for you to learn and learn very well. If you miss internship and you do not do yourself well during your clinical test, you have pain. Understand? So it's not you are not a senior recruiter going ahead. Then it now depends. You can ask my chief now that is senior recruiter, I believe it's pass on my chief. What is that? Thank you very much. So you understand. So it depends on where you are working. And when you are working, where you are working, I'm sure you are not the only one. You're going to shake that. Thank you very much, sir. We are moving exceeded our time, but for the sake of the discussion, I'll just try to bring this in questions. No more questions. So, sir, this question I want to deal with you today. It said, how much does an average radiographer or intern earn? How much do they make? You know, sir, don't know. So, sir, how does an average radiographer? Thank you very much, sir.
Well, I won't talk for it. She's here.
Okay.
Well, there are elements anyway. You don't want to mention the amounts?
Yes, sir. How much? Average. I don't know average. How much do you think?
Our tax is high, so
how much?
I'm a principal radiographer. And my is it gross or take?
Principal, 300 and something.
370 or so.
370. Now, when we are talking of remuneration for radiographers, it varies and differs based on where you are working. Understand? We have the government sector and we have the private sector. And another key thing is for the private sector, what and what they have and what you can offer. You understand? Yes. He has given us a range for his own place of work. And I think general, federal, that private, okay, I they tend to pay more depending on what they have, and the things that you work for the money. You understand? That you work for the money. Then government, once you get the government job, at the later stage, you might not, you will just work with what they have in Parasata. And as time goes on, with increment, promotion, and what is it called? So the salary differs. Okay, where I work, based the fact that I'm the only one there, and what I do there, I'm ending up around 450 or but I told you private, you will cover the money. So it depends on what you can offer. So just prepare yourself. Thank you very much, sir, for that question. So I want to questions there. Any question? For this question is in one. The first one. If you could. Okay, for intent, right? So, Ma, please, how much? How many? Average. 250. How many more don't think getting right now?
Don't focus on the money. By the time you start collecting the money, you will know the money is wrong.
And the second question, what do you have to say to people that are not confident in the course? That is, they are not confident enough to see better courses as equals. That's what the question says. Okay? Okay. Give your confidence. Thank you very much. Thank you very much. And this brings us to the close of the panel session. Please, a round of applause for our panelists. They really prepared enough and enough for us. But we've asked them and they have answered. So thank you very much, sir. Thank you. It's a pleasure for us. Thank you very much.
Please let's jam our hands together for the panelists. You can do better than that. Okay, so can we all echo thank you, stars and mom? Thank you, sir. So we are moving on. We are bringing the program down to the soon, but not yet. So right now, we inviting the Creator Free Africa for mental health awareness. So let's jump around up to good afternoon, everyone. Good afternoon, everyone. All right, so for that wonderful panel section, please can you give a round of applause for the panel? All right, so my name is Mokocha Chijoke. I'm the Executive Director of Motivators Group Africa, an organization that deals with the issues of mental health and drug addiction. All right, so with me here are my families. We call ourselves family, and also please help me appreciate my family. And please help me appreciate yourself too for being here. Alright, so as we start, I just want us to do something very simple. Can you ask your neighbor, how are you? Look at your neighbor, ask him or her, how are you? Be intentional about it. Ask your neighbor, how are you? What's the response? Alright. Alright, so you know that when you have time to ask someone, I'm not Alright, so when you have the opportunity to ask someone this simple question, how are you? The response is always, and the final question is, are we truly fine? Alright, so
your phone back with your 1% to 100%. Can you rate your mental health? Alright, can you rate your mental health? 60%, can you rate? 20, 30%. 35. Alright, then a round of applause for them, please. Alright, so I want us to pay rapt attention. I was speaking at a seminar and I asked the question, rate your mental health. And a young lady said 5%. And everybody realized just the way we are all laughing now. And we didn't know that she was about to commit suicide. So her 5% was actually her 5%. And when we have the opportunity to talk to young people like us about mental health, we encourage everyone to give a listening ear and make sure you reach out to the people that are close to you, families, friends, and loved ones. You can actually reach out to them and ask them this simple question: how are you? You can reach out to them and ask them this simple question: how are you? It is very important and very pertinent that we check up on people and ask them these simple questions. Because when I was speaking earlier today, I was saying something that we live in a generation of happy pictures and a sad generation of happy pictures. So when you go to the internet, you see a lot of people smiling, laughing, playing, and all. But inside of them, they are battling and bottling situations that they need just someone to give them a listening ear. So when you have the opportunity to speak to someone, please ask him or her a simple question: how are you? Alright, so this takes us to the topic that we are going to be creating: low self-esteem. I want to ask us a simple question. Have you ever at one point felt that you are not enough? You are not enough for anything? Please, it's a safe space. We listen without. So let's communicate. Have you at some point felt like not being enough? Like you need someone to validate you before you validate yourself? And so I happen to be a victim of such. I happen to also be a victim of depression, mental health issues for over 50 years of my life. And that is why I am passionate about what I am doing. So I am not here for us to joke, I am here for a serious business. To see how we can actually help someone here and we not even know to survive that particular situation that they are faced with. I want to let us know that apparently we have over 60 million Nigerians who are deemed not mentally fit. I don't even know whether part of the 60 million, I don't know whether you're part of the 60 million, but we have 60 million Nigerians who are deemed not mentally fit. And every year, 700,000 persons, 703,000 persons take their own lives every year. And that is one person in 40 seconds. So you can imagine how many seconds you have spent here, listening to the speakers, the panelists, and even listening to me. You can imagine how many lives that actually have been taken because of suicide. So sometime in April, we lost a young boy to suicide. And this boy was all happy today, for example, and the next day he committed suicide. So what happened between yesterday and today? And that brings us to what I call smiling depression. So you see someone all smile, all happy, all jovial, but you don't know that the person is going through stuff. And I want us to know today that if you see something that you are not sure about in someone's life, please reach out to the person, and if you can, reach out for someone for support for the person. ghostwriting me. So I want you to write on a sheet of paper what you can do or what you want to do. For example, if I say, I can pass that particular course that I've been struggling with. I will let us know what we are going to do with our nice statements when the time comes. So that one thing that you want to succeed in, please write it down. I can pull through this difficult situation. Write it down, please. Now, I want us to understand something about low self-esteem or self-doubt. This is low self-esteem or self-doubt makes you feel low of yourself, or make you feel that you are not worth the while, or make you feel that you are not good enough. And that is a lie from the pit of hell, because I'm going to tell you today that whatever you put your mind to achieve, you will achieve it, only if you believe. So low self-esteem or self-doubt impacts your life negatively, and it ends in depression or anxiety, and that is how people commit suicide. Because they feel they are not what is, they feel they are not enough. Now let's look at the causes of low self-esteem. We have past experience, maybe the experiences you have had in the previous time. We have comparison, when we want to compare ourselves with people. When you are striving to fit in. And I tell you the truth that social media are what we see and not what it is. You believe me, right? Social media is not what you think it is. And that is why I said something that we live in a sad generation with happy pictures. And I want you to know that comparison is not the way to go. Then another cause is perfectionism, when you want to be perfect about the thing. Another one is trauma and emotional problems, when you don't forgive yourself of the problems that actually have, that actually have come your way. Now, how do we break free? How do we break free from these problems? How do we survive low self-esteem or self-doubt or the challenges that comes with mental health issues? Now we have one, practice self-care, self-compassion, and self-love. And when I have opportunity to talk to people, I tell them something. Self-care is not selfishness. When you want to take care of yourself, or when you have to take care of yourself, it does not mean that you're selfish. You have to take care of yourself for you to take care of other people. Number two is self-discovery. Have you discovered yourself enough to know why you are existing? The reason for your existence. Why are you living? Why are you living? The reason for your existence. Then the third one, which helps me a lot, is your belief system. It's your belief system. What do you believe in? What do you believe in? Because it's what you believe in that empowers you to do better in life. That's what you believe in. It's what helps you to overcome difficult situations and difficult emotions. There is something I tell myself, that in the uncertainty of what lies ahead of me, I know one thing for sure, that I will do exceedingly great. I will be excellent at whatever I do, and I will do it perfectly well. That is my belief system. So what is your belief system? What do you believe in? Another point I want to give us is, for you to survive whatever situation that life has brought to you, you need to forgive yourself. You need to forgive yourself of your past mistakes. You need to forgive yourself, forgive the families, forgive the people that actually have brought difficulties to your life. That is a pathway to progress, a pathway to healing, forgiving oneself. Then another point I want to give us is embrace gratitude. Be grateful for what you have and where you are and what you are doing and what you intend to achieve. Embrace gratitude. Another point I want us to have is challenge negative thoughts. When the negative thought comes to you, you challenge them. For example, so many years back, when we started the organization, we had a lot of people coming to us with negative thoughts can put whatever it is that I put my mind to. So you need to challenge negative thoughts. You need to change the I can't to I can. You need to change the I can't to I can. So that brings me to this part. If you know you are putting the I can't statement, can I say alive? Alright, so to be getting the mic across to you, I want you to say what you have. And then this is what we are going to be doing. If the person reads what he or she has, you respond with yes, you can. Am I good? You respond with what? You respond with what? Alright, so let's have the first person here. Hey. No. Take this one.
I just so what I can achieve my dreams without.
Alright, so why saying I want you to believe? Sorry, why saying I want you to believe in that thing that you are waiting and put your mind to it? And please support her by saying yes, you can. Alright, so let's have it.
I can achieve all my wishes and dreams without being distracted.
The next person.
Yes, no. This I wrote, I can be the best version of myself.
Next person. Take the other mic.
Good afternoon, everyone. I can manage my time efficiently.
I am in love and I am a survivor.
I can buy free Lamborghini before the end of this year.
I can forgive myself for my past mistakes.
Alright, so a round of applause, please. Because of time, a round of applause. Alright, this is a way of us affirming what we believe in, affirming what we want and what we want to survive. And if you believe in that thing that you really want, then yes, you can. Alright, so the next point I want to talk about is build a support system. Build a support system. Who are your friends? Who are your friends? Who are the people that you're going with? I tell people that no matter how fast you run in the wrong direction, you can't get to your destination. Speed becomes a disadvantage for you. So you need to build a support system of people who values you and people who helps you to grow. And I call it OQP, only quality people. So you have to make sure that the support system that you have are people who are quality. Now, another point is know your self-worth. Know what you are worth. Never believe a prediction that does not empower you. Never believe a prediction that does not empower you. And the apostle was asked one day that how do you respond to naysayers? And he said before they come to say that this thing is not possible, he is already responding with it is done. So you don't have the opportunity to say that this thing is not possible. So he responds with it is done. So what is your response to people who comes with a prediction that does not empower you? Never be afraid to lose people. I was talking one day and the young man asked me a question. He said, his uncle who wanted to support him with some money telling him that if it is not what he wants him to do, he cannot support him. million people involved in the war. And I was telling him, and I'm going to tell you this thing today, that your destiny does not lie in the hands of one man. Your destiny does not lie in the hands of one woman. Your destiny lies in your own hands, and you have to take charge of it and make it become what you want it to be. And today, that young man is doing expert because he took his destiny in his hands and never believed an uncle that wanted him to be someone he never wanted to be. And that brings me back to the question I asked you, if you have discovered yourself. So you have to discover yourself and run to think. Don't be pressurized. Don't shrink to fit in. When you have a group of people that want you to be like them, don't shrink to fit in. Practice self-compassion, seek for proper help, and also above all, trust the process and trust God. I want to give us what we call a 5-continent lead in the organization. 5-continent lead. And the one is you have to move from I can't to I can. You have to also shift from busy to being productive. You know, there's this thing about I am busy and you are not productive. So you need to move from being busy to becoming productive. Then the fourth one is avoid excuses. In the organization, we have a mantra and we have what we call a culture. And that is no fears, no excuses, no limitation, and no doubts. You don't have to doubt that you have the capability to achieve the task that is being given to you. Then the number 5 is you move from being a victim to being a leader. So the victim mentality needs to leave you for you to be that leader. I want you to understand that you are not just the way you are. And it does not take anything other than your mindset to build yourself, to have that resilient spirit that will elevate your self-worth, giving all the low self-esteem that you are dealing with. As I round up, there is something we call an art expression. Okay, we shared this card, what's it called? Affirmative words, right? If you have the affirmative words, let's see it. Alright, so we are going to pass the mic around again, and then you list what you have. Just within some minutes. Alright, so this affirmative words makes you to have a sense of self-worth, self-belief, that whatever it is that comes your way, you have the capacity to go to. Yeah. This is what you have.
I honor the progress I will make, and I appreciate my personal development. No matter how small, I am growing every day.
Yeah, so this makes you believe that no matter how small the growth is, so far it is consistent, then know that you are actually getting where you are going to. The next person.
I am at peace with where I am today. Why knowing that I have always tried for more?
You should be at peace and then you have to pay and know that you have the capacity to strive for more.
I release what I cannot control and focus on what I can. Peace is within me.
That is the utmost thing, to know that peace is within you. So those things that you don't have the capacity to control, please build your support system within the things that you have the capacity to control. There is a thing I tell people that we must remove our mind from the fact and from the thing of hope that the sea never rests. We need to adjust ourselves and our compass for the wind to blow us to where we want to go to. Next person.
I am becoming the best. I release what I cannot control and focus on what I can. Peace is within me.
Peace is within you, yeah.
Sure, be gentle and kind to thyself.
So this makes us understand that you deserve love, you deserve compassion, you deserve to be gentle and kind to yourself. Next person.
I am capable of handling
handle whatever comes my way. I trust myself to make the best decisions.
So you need to know that you are capable to handle whatever comes your way, and you should trust yourself to handle the decisions that you want to make here.
The strength to overcome difficult emotions and the wisdom to let go.
So you need to build your wisdom and have the wisdom to overcome difficult emotions or challenges and all. So as I wrap up, there is something we call the art expression. We are going to be just maybe 2 persons and maybe on the long run. We will call you out to just maybe you don't need to draw a lot of things, but the thing that resonates need might feel or hope to you. I don't know, I have been through mental health issues, and I know what it is to have peace. I know what it is to have hope. I know what it is to have mind freedom. Mental health issues is more like when you are living in bondage, and more like when the thick cloud is close up on you, and when you feel like you don't know what to do. So today we are going to be releasing ourselves all down on him and getting to know that when you make this, you relieve yourself of whatever thing that has been. So you end it here, and then know that you are going to be a new person from that next one. If you believe that you have the capacity to stand out from whatever mental health issues that you might be battling with, I don't know, but I'm talking about my own, then you stand the chance of getting the healing that you want. Before we go into this section, I want to take us through the section that I love the most and that have impacted my life positively. And that is what we call stamping like an elephant. When you feel like a lot of things are hovering all over you, how do you react to it? Well, to people like us, we stamp like an elephant, and we believe that we can pull through whatever we put our minds to. So when I say